research is the present and I think future of the homeopathy. Being research oriented is the need of an hour, and so we must all be an active contributor to the development of homeopathy science. Every possible research should be used by the homeopaths to explore the novel things and make homeopathy the much classified and great therapeutic pathies in our community. So this conference on advancement of research in homeopathy will be surely contribute our great efforts to add its credibility and reliability to in our community. And for this I would like to extend on behalf of our organizing committee to express my sincere gratitude to all of you for joining us today, and I extend my best wishes to all the students, all the presenters, and all the keynote speakers who joined us today. Thank you so much for coming. Thank you so much.
Thank you, ma'am, for your generous words.
Thank
And
you.
now I would request our Dean and Director, sir, to kindly welcome our guest today and kindly proceed with the program. Dean, sir, please.
को बोलना गर्म पानी देना पीने के लिए.
Now,
आप अपने आप को अनम्यूट कर लीजिए. शर्मा सर, प्लीज अनम्यूट योरसेल्फ.
प्रोफेसर शर्मा अनम्यूट करो अपने आप को.
आप अनम्यूट कर लीजिए अपने आप को.
I request our honorable advisor, sir, to please address all of us.
Namaste, Atithigan.
नमस्कार.
There is some technical issues. Since 2 days, we are facing so much technical issues due to the bad weather conditions.
Yeah, it's very stormy. Yesterday it was also very stormy. There is storms and rain.
He will be, I think, advisor sir will be connecting with us in few minutes again. So till then, I think President sir, you can continue.
Yes. So, Namaste, Honorable Chairperson ma'am, Honorable Advisor and CEO Vedant Garg sir, and today's chief guest Anil Khurana sir, and our newly constituted, newly made Homeopathy University Chair, Henneman Chair, Professor Dr. SPS Bakshi sir. Sir, it's really good to see you here among us, and then other speakers who will be joining us in a short while. And also, Dr. Pankaj Sharma sir, who is Dean Homeopathy, DSSRAU Jaipur, he is also here with us, and the Director, Dean of Faculty of Homeopathic Science. First of all, I welcome all of you in this conference, which is being held in this international conference, and the topic is very vibrant. It's very needed topic: advancement in homeopathic research, including clinical trials, laboratory research, and case studies. Actually, this is a pathy which is in fashion from so long, which is being practiced from so long. So it is very important to establish some of the fact that more research is required to be taken up in the current scenario, and that's why this conference is being conducted here. Students are also excited. They will participate in the conference. Speakers will be here, and I am sure no deliberations will be given during this 2-day conference today and tomorrow. And there is no doubt that I congratulate Faculty of Homeopathic Science, the entire organizing team, for the very warm opening of this 2 days international conference. And at the end, I wish all the best to the Faculty of Homeopathic Science for the successful completion of this international conference. Thank you very much. Jai Hind, Jai Nari Shakti.
Thank you.
Thank you, sir.
Thank you.
Respected advisor and CEO, sir, are back online. So it's my humble request, sir, please provide your blessings and please say a few words on today's conference. Our advisor and CEO, sir, Honorable JVN Mr. Vedant Garg, sir. Please, sir.
नमस्ते सभी अतिथिगण. Sorry for the inconvenience caused. I welcome our honorable chief guest, Dr. Anil Khurana ji, Chairperson NCH. He will be joining us later today. Our Chair Professor, University Hanneman Chair, Dr. SPS Bakshi sir, MD Baxon Group, our Academic Council member, Dr. Pankaj Sharma sir. Namaste sir. And all our invited keynote speakers, the faculty members, students of Faculty of Homeopathic Science. I welcome you all for this two-day virtual international conference, which is being organized under the Faculty of Homeopathic Science. In the recent years, especially during COVID, homeopathy popularity with the health professionals has increased rapidly as a result of clinical trials demonstrating its efficiency. Advancements in homeopathic research aims to promote and research in homeopathy will make it available to the masses at large to bring the outcomes of latest research and clinical studies to the mass public. So, with an aim to serve the best virtual conference networking experience, to share the clinical research work in form of integration and correlation-based papers, through this international conference, our students and researchers will get a chance to connect with academic, healthcare experts, and potential mentors for the sharing of knowledge and the enhancement of knowledge with the keynote speakers' discussions and scientific interaction to refine the research work as per society and health sector needs. I hope, like every year, our students give the best in all stages of the conference, and I add my sincere best wishes to all the organizers, coordinators, students, and faculty members of FHS for a successful and fruitful conference. I sincere I extend my sincere thanks to all the invited guests, especially Dr. Anil Khurana ji, who will be joining us later at this international conference. Thank you so much. Jai Hind, Jai Nari Shakti.
Thank you. Thank you, sir. Vedanti, thank you.
Thank you very much, sir. Thank you very much. Request to our chair, Professor Sir, Dr. SPS Bakshi, please give your remarks for the theme of this today.
Yes. Honorable Chairperson, Mrs. Mithilesh Garg, Chief Patron of Conference, Honorable Advisor and CEO Vedant Garg, and above all, Dr. Anil Khurana, who is the Chair National Commission of Homeopathy, New Delhi, and of course, Professor Sharma, आपको भी and Registrar Hema Bafila को भी. I personally feel this topic is very much needed today regarding research and advancement and how to see the next 10 years in homeopathy, next 10, 20 years for homeopathy. You see, as you know that I have been president of the first elected president, Central Council of Homeopathy in 1991. I was there for 18 and a half years, and I've seen the growth of homeopathy from diploma till degree, then MD and PhD in homeopathy. I've seen complete evolution of homeopathy in the last 50 years of my practice and in Central Council of Homeopathy. See, there was a time when we needed more colleges, and we encouraged every state to have a new college. And when I started, it was we had only 84 colleges. And today we have 268 colleges in homeopathy, and 37 are run by government. So the future is excellent in homeopathy. But one thing I've noticed that होम्योपैथी में पब्लिसिटी की बहुत कमी है. You see, we are curing patients, but we are not talking about homeopathy. Ayurveda, for example, is giving a lot of publicity to Ayurveda. The result is that Ayurveda has gone to masses. Ayurveda is an excellent science, but I feel homeopathy has a better edge because our homeopaths are not, majority of them are not practicing allopathy at all. In my state, Delhi, New Delhi, there are more than 1,000 homeopaths who are practicing only homeopathy. So we need to do research, and above research, हमें उसका awareness करने के लिए we must go to the masses. We face a lot of problems in distribution of homeopathic medicines. In allopathy shops, हमारी दवाइयाँ नहीं मिलती थी because उनको homeopathy license लेना पड़ता था, so they were hesitant to keep, and demand was less. But like in Ayurveda, you can just go to any allopathy shop and you can get allopathic medicine along with Ayurvedic medicine. But after long persistence, हम लोग जो मेहनत करी इसके पीछे कि जाके गवर्नमेंट ऑफ इंडिया को अवेयर करें कि होम्योपैथी मेडिसिन मस्ट बी sold in allopathy shops. So government has issued a notification in 2017 that homeopathy medicine can be sold in allopathy shops. That means availability of the medicines is there now. Imagine in homeopathy, we don't have more than 2,000 stores all over India. Today, allopathy is available in allopathy stores which are in big number. 20 लाख होम्योपैथी एलोपैथी फार्मेसीज हैं. अब हमारी दवाइयाँ होम्योपैथी वहाँ भी अवेलेबल होंगी. सपोज आई प्रिस्क्राइब वन मेडिसिन, पेशेंट पूछता है ये दवाई कहाँ मिलेगी, एंड नाउ इट इज सो इजी. इन दिल्ली देयर आर 70,000 एलोपैथी फार्मेसीज, और उनमें से 5,000 फार्मेसीज में हमारी होम्योपैथी मेडिसिन अवेलेबल हो गई हैं. और धीरे धीरे आप देखेंगे कि ये सारी कंट्री में अब इसकी एक पहचान होगी बिकॉज ऑफ अवेलेबिलिटी ऑफ होम्योपैथिक मेडिसिन. सेकेंडली, जो हमारा जो ओटीसी रूट है, ओटीसी ओवर द काउंटर, वो जब पॉपुलर होगा तो होम्योपैथी के बेनिफिट्स पता लगेंगे लोगों को, एंड ओटीसी मेडिसिन विल बी सोल्ड लाइक ओनली च्यवनप्राश इन आयुर्वेदा. उसका सेल कम से कम हजारों करोड़ों में है. एक एक कंपनी 500 करोड़ की वो च्यवनप्राश बेच रही है. ऐसे हमारी होम्योपैथी दवाइयों में नंबर 1 दवाई आ रही है आज की डेट में कैल्केरिया फॉस, कैल्शियम फॉर चिल्ड्रन. अब देखिए एवरी एलोपैथी शॉप हैज कैल्केरिया फॉस. ये आपको नई जानकारी दे रहा हूँ मैं, जो रिसर्च करी हमने देखा है कि इसकी कम से कम 400 करोड़ की मार्केट होम्योपैथी में हो गई है कैल्केरिया फॉस 6x की. मैं पूछती हूँ कि डॉक्टर साहब किस उम्र में शुरू करें कैल्केरिया फॉस देने के लिए. This is because of awareness about calcareous phos, like thuja, like antimony crude for corns. They are specific, almost specific medicines for warts and corns. So I think research के साथ publicity is very important, and the best thing which has happened to homeopathy is NEET. NEET आने से हमारी जो quality of students आ रहे हैं, they are at par with allopathy. पहले बैकडोर एंट्री होती थी, मेट्रिकुलेट्स आते थे, 40% वालों को एडमिशन मिल जाती थी. अब ये बच्चे जो आ रहे हैं इनकी ग्रास्पिंग पावर बहुत अच्छी हो गई है, एंड सेकंड एंड थर्ड जनरेशन के होम्योपैथ आ गए जिनके फादर होम्योपैथ हैं या ग्रैंडफादर होम्योपैथ हैं. उनके बच्चे आने से होम्योपैथी बहुत अच्छी स्प्रेड कर रही है, एंड आई एम सो कॉन्फिडेंट दैट नेक्स्ट डिकेड आप देखेंगे ये डाटा जो है 26% ग्रोथ हुई है लास्ट ईयर होम्योपैथिक इस कंट्री में, विच इज द हाईएस्ट इन द वर्ल्ड। किसी भी फार्मास्यूटिकल इंडस्ट्री की 26% ग्रोथ होना इज वेरी बिग, hardly it is 3 to 4%. So this speaks homeopathy is getting popular not only because of side effects of allopathy, but because of lovers of homeopathy, जो कहते हैं हमें homeopathy चाहिए because of no side effects. I think with good students, with the infrastructure of the colleges has improved tremendously, and the latest, I wish Anil ji was here, Anil Khurana, इन्होंने बहुत काम किया है कि जो नई अभी इनकी जो पॉलिसी आ रही है, इंटीग्रेटेड कर रहे हैं और आपको अंदर हॉस्पिटल मैंडेटरी कर दिया, जिसमें पूरा कैट स्कैन, आईसीयू, पूरी चीजें चलेंगी उसके अंदर, सो दैट कि बच्चों को अच्छा एक्सपोजर मिले। At Baxter Homeopathic College in Greater Noida, our OT is working, our ICU is working, और बच्चों रात को ड्यूटीज कर रहे हैं, वो डिलीवरी देख रहे हैं, पेशेंट देख रहे हैं, they're learning differential diagnosis. So this good work done by NCH, the team, and Ayush department, especially our secretary जो हैं आयुष के राजेश जी, इन्होंने बहुत अच्छा काम किया है और आप देखेंगे इसका इफेक्ट आने वाले 10 से 20 साल में homeopathy will become the first line of treatment among masses. I think with these words, I have nothing more to add. Thank you very much for your patience. Thank you.
Thank you, sir.
Thank you so much, sir, for your kind words.
Thank you.
Unmute yourself.
Yes. Now I request our academic member, our Honorable Dr. Pankaj Sharma ji, sir, kindly say a few words and address all the students of Faculty of Homeopathic Science. And thank you for joining us.
Thank you very much, Shema ji, dynamic registrar of the university. First of all, I would like to thank Jyoti Vidyapith to organize this wonderful conference, which needed as a part. Hello, I am Dr. Pankaj Sharma. सबसे पहले मैं इस कॉन्फ्रेंस के अंदर विश करना चाहूंगा डॉक्टर पंकज गर्ग जी को, जो मेरे छोटे भाई की तरह थे और जिनका विजन था, और ये उनका विजन है। आज वो जहां भी होंगे इतना खुश हो रहे होंगे इस टॉपिक को लेकर के, जो हम इंटरनेशनल कॉन्फ्रेंस करने जा रहे हैं और जो इसको सक्सेस होना स्वाभाविक है। जो पैनल आपने बनाया है जिसमें डॉक्टर SPS बख्शी डायनेमिक चेयरमैन रहे हैं 20 साल तक कंटिन्यू सेंटर काउंसिल के, जिन्होंने पूरे हिंदुस्तान की सिनेरियो चेंज कर दिया एजुकेशन का, होम्योपैथी एजुकेशन का। अभी जो अनिल खुराना जी हैं, उनकी तारीफ के लिए मैं कुछ नहीं कह सकता आपको, कि वो जो छोटी मोटी कमियां थी उनको दूर कर करके और सारे कॉलेजेस को एक बहुत अच्छी राह पे लेके जा रहे हैं। लेकिन उसके साथ वेदांत गर्ग जी, मैं आपको भी बहुत बहुत धन्यवाद देना चाहूंगा कि आपने किस ढंग से और कितने शॉर्ट टाइम के अंदर इतनी बढ़िया कॉन्फ्रेंस को ऑर्गेनाइज किया, और इतने बढ़िया स्पीकर्स, मैं इन सब से मिला हुआ हूँ ज्यादातर लोगों से, और उन लोगों को ऑर्गेनाइज कर करके और अपने बच्चों को और होम्योपैथी फर्टिलिटी को जो किया है, मैं उसका तहे दिल से आपका बहुत बहुत शुक्रिया अदा करता हूँ, बहुत बहुत शुक्रिया अदा करता हूँ। डॉक्टर बख्शी जी, आप ये देखिए फार्मास्यूटिकल के अंदर, एजुकेशन के अंदर, इनका कॉलेज के अंदर, हर चीज के अंदर नंबर वन बैक्सन कॉलेज, बैक्सन होम्योपैथी अपना करते हैं। कहाँ था पहले, कोई ऐड भी नहीं आता था कहीं पर, आज हर दिन टीवी पर देखिए बैक्सन होम्योपैथी आ रहा है। बहुत सीनियर चेंजेज हो रहे हैं, इसमें मेरे को बहुत खुशी मिलती है। लेकिन हम हमारे बच्चों को बहुत अच्छा सिखाएं, उनको बताएं कि हम हैं क्या, होम्योपैथी है क्या, कहाँ तक प्रोग्रेस हो गई है। उस सब्जेक्ट को आप एडवांसमेंट को लेकर के जो आप आए हैं, वो उसके लिए मैं बहुत 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 धन्यवाद देता हूँ आपको। और कुछ जो मैंने थोड़ा सा कलेक्शन किया है थोड़ा सा शॉर्ट टाइम के अंदर, मैं बोलता हूँ उसके लिए। Dear friends, today I would like to share with you a report of the study which found homeopathy both economical and effective. Securevita, a German health insurance company, released a analysis of the data in 2020 from its policy holders that show that those who received homeopathy care are significantly better off and need fewer favor of the conventional medicine than those who received ordinary conventional care without homeopathic treatment. The new studies Zor homeopathic words flesh the study find homeopathy economical and effective. Comparative data of the nearly 16,000 Securita policy holders who have been regularly treated by homeopathic health insurance physicians for the least 3 years. Last year's with the equality large control group that has received ordinary constitutional care without homeopathic treatment. It shows the real life benefits and the improvement of the homeopathic treatment documents in its insurance data over several years. This applies to both children and adults suffering from the wide range of the conditions. The effectiveness of the medicine homeopathic treatment is demonstrated through the number of the measures such as the lower consumption of the strong drugs and the reduction is the number of the days of the work, fewer hospital admissions and the shorter hospital stays. Especially the study shows the reduction in the use of the antibiotic in the children treated by the homeopathic doctors compared to those conventional medicines group. This reduction continues over the 3 years study period with the number of the antibiotic treatment declined by the 70% in the homeopathy group while it went by the 74% in the comparison group. It also shows large differences in the care of the patient with the depression, cancer, multiple serious illness, cancer patient in the homeopathy program required anti-depression less frequently that is in the comparison group the need of the painkillers declared among the cancer patients and those with multiple illness during homeopathic treatment while it rose in the control group. Small children experienced a reduction of the allergic neurodermatitis and the asthma with the homeopathic treatment. Compared of the increase of the requirement frequency in the control group, the number of the hospital admission for the adult suffering from the depression dropping by the 10% under the homeopathic treatment compared to the 33% increase in the control group. While the number of the days of the work of those who depression reduced by the 70% with the homeopathic treatment compared to the increase of 17% in the control group of over 3 year period. Scorveta in the one Germany leading health insurance company and promotes itself a pioneer for the neuropathy, naturopathy, provider of the modern medicine, driver of the prevention services. It has been voted Germany best health insurance company. Board member God's Honey Metz says the study that it is strong evidence of the homeopathy deserves the appropriate place in the healthcare. The study was conducted by the Leibniz Health Forum, an independent analytic institution specialization in the health service research. The basis of the data collection was a contracted between the health insurance company Scorota and the National Association of the Legal Health Insurance Physician (KBV). Compulsory health insurance physician with the additional homeopathic qualification have been treated Scorota policy holders since 2009 and offer them in a deep medical history of the discussion, homeopathic counseling, and the therapeutic support. The study confirmed that the medical treatment with the homeopathy is an important and the effective addition to conventional medicine in daily care. Homeopathy shows a clear positive therapeutic effect and a better cost benefit ratio for the select disease than purely conventional therapies. Thank you. ये सारी बातें मैं आपको बता रहा हूँ कि इंश्योरेंस कंपनियां पहले अमेरिका की कंपनियां वगैरह ही हम लोगों को कहती थी कि नहीं ये प्लेसिबो है हम नहीं करेंगे। अब उन्हीं की स्टडियां हम लोगों को फेवर कर रही है और उनकी इंश्योरेंस कंपनियां इस चीज को इंक्लूड कर रही हैं। ये एक होम्योपैथी के लिए बहुत चमत्कार है, बहुत अच्छा है और उसके लिए हमको उसके लिए आगे करना है। इन छोटी छोटी बातों के साथ ही मैं आप सबका थैंक्स करता हूँ। आपने मेरे को बुलाया, बहुत बहुत धन्यवाद। थैंक यू।
Thank you very much, Pankaj sir, for your nice words and informative words. It was in length.
Thank you, Dr. Pankaj.
Discussion.
Spoke well.
Thank you,
very
sir.
much.
Thank you. Thank
And,
you all, sir. Thank you. Thank you.
You're welcome, sir. And now I'm seeing here Dr. Aisha Ali, Registrar, MP Council of Homeopathy. Am I audible to you? Because I'm seeing name added here already. Okay.
She's very shortly, sir. Sorry for interruption.
So, yeah, Ravi Jain sir, if you are hearing me, kindly call the students for the presentation. Let the presentation start because Bakshi sir is also here, Pankaj sir is also here. So, let's take their advantage also. I think it will take a little time, the students to get organized.
Dr. Aisha आ गई?
सर मैं थोड़ी गुड मॉर्निंग एवरीबॉडी थोड़ी देर के बाद गुड मॉर्निंग एवरीबॉडी मैं आपको थोड़ी देर के बाद ज्वाइन करती हूँ बिकॉज अभी थोड़ा वो है बस 5 मिनट के बाद आपके पास आती हूँ।
ऑफिस में काम है।
गुड मॉर्निंग, कैरी ऑन।
गुड मॉर्निंग मैम।
गुड मॉर्निंग, कैसे हैं आप? सब लोगों को वेलकम। और अभी पंकज जी ने बहुत अच्छा बोला। थैंक यू पंकज जी।
थैंक यू। थैंक यू।
थैंक यू।
सब बच्ची सर से और आप लोगों से सीखा है।
अच्छा अच्छा।
पंकज सर, थैंक यू वेरी मच फॉर योर डिटेल।
बहुत अच्छा बोला पंकज जी ने, गुड इन्फॉर्मेशन।
And data collection is also there.
Good.
Really appreciate.
Bakshi Saab is the great personality and dynamic personality in here, in India and world.
Yes, sir. No doubt about it. No doubt about it.
He is the son of the homeopathy.
Yes. उनकी बराबरी अभी बहुत मुश्किल है करना।
Nobody can do.
Yes.
Yeah. The students will be joining us in a short while. Yes, they will be joining us in a moment. There was some technical issue. Over to you, Dr. Ravi Jain.
Namaste, sir. Respected Honorable Advisor and CEO, sir. Respected Registrar, ma'am. Our respected guests, Dr. SPS Bakshi, sir. Dr. Aisha Ali, ma'am. Our President in charge, sir. Dr. Pramod Raghav, sir. Thank you for giving me this opportunity to start with this presentations for today's event. Now I'll be asking the BHMS 4th year students to present their work that they have done one by one. So first of all, I'm calling Palak Sharma from BHMS 4th year to present her PPT of her work. So over to you, Palak Sharma.
कोई आ रहा है कि नहीं आ रहा है अभी? प्रोफेसर शर्मा?
जी सर।
और नेक्स्ट स्पीकर कौन आ रहे हैं?
आयशा अली मैम आएंगी, लेकिन अभी बच्चों का प्रेजेंटेशन करा रहे हैं सर।
मैं फिर थोड़ी देर के बाद ज्वाइन करता हूँ फिर आपको।
ओके ओके सर, ओके।
थैंक यू।
स्टार्ट पलक। Voice is not clear.
Unmute yourself. Unmute yourself, Palak ji, unmute.
Namaste, Honorable CEO and Advisor, Sir, respected Registrar Ma'am, our Chief Guest, and all the higher dignitaries present over here. I, Jeevin Palak Sharma, pursuing BH in his fourth year, is here with my topic, Role of Homeopathy in Alopecia areata. The word alopecia is originated from Greek word alopex, and areata is derived from Latin word area, meaning a vacant space or patches. Alopecia areata is a disease where hairless patches develop on scalp. It is chronic, recurring, and autoimmune disorder. It is a complex autoimmune condition that causes non-scarring hair loss. We recorded a prevalence rate of 20.4% for pediatric alopecia areata, consistent with most Indian studies. There are three types of alopecia areata: patchy alopecia areata, alopecia totalis, and alopecia universalis. Alopecia areata is caused by family history, hormonal changes, medication, and stress. The most prominent symptom of alopecia areata is patchy hair loss. Point-sized patches of hair begin to fall out, and mainly from scalp. Any site of hair growth may be affected, including the beads and eyelashes. Sudden hair loss is seen. For investigation, we will go through examination, examine the area of hair loss, examine hairs and hair follicles, ask about medical history and family history. Homeopathic medicine, we can prescribe fluoric acid, phosphorus, arsenic album, arnica montana, and pulsatilla. With the help of homeopathy, we can cure alopecia areata by case taking and individualization of patient. For bestest results, we can reduce cases in our community. Homeopathy is safe and highly effective in curing the cases of alopecia areata. Thank you.
Thank you, Palak, for your wonderful presentation. Now, I'm inviting Anjali Kushwaha for her presentation. There is a little bit lag because of the network issue, so I'll just request you kindly wait for 2 minutes before the presentation starts. Thank you, sir. Now, I request Anjali Kushwaha to start with the presentation.
पंकज सर, मैं आपसे रिक्वेस्ट करूंगा कि आप बने रहें हमारे साथ, और बच्चे अभी प्रेजेंट करेगा तो थोड़ा बहुत क्वेश्चन आंसर, हल्का फुल्का कोई सजेशन जो भी, सो दैट दिस प्रेजेंटेशन में आल्सो बी मॉडरेटेड. विदाउट मॉडरेशन तो कोई मतलब नहीं है. हाँ जी, आप अनम्यूट कर लीजिए सर अपने आप को.
Namaste
Yes.
to respected advisor and CEO JVN Vedant Garsar and respected registrar JVN Hema Wafila ma'am and our respected chief guest and all my higher dignitaries. And my dear, I am JVN Anjali Kuswa pursuing BHMS fourth year from the Faculty of Homeopathic Science. My topic is nephrolithiasis. Introduction. The renal stone is one of the most common disease of the urinary tract, also known as a nephrolithiasis and renal calculi. The kidney stone is hard solid mass of the material that forms in the kidney from the substance in the urine. The stone may be formed in the kidney, urinary bladder, and urethra. The cause of nephrolithiasis, the fluid intake, immobility, and hypercalcemia and hypercalciuria, excessive intake of vitamin D, milk, alkali, chronic dehydration, diet, high enough purines, and abnormal purines in metabolism. Clinical features: severe sharp pain in the side and back, below the ribs, pain that radiate to the lower abdomen and groin, nausea and vomiting, pain in the back, pink, red, brown color, feeling the need to pee, fever and chill, cloudy or smelly urine, burning or pain while urination. Investigation: X-ray, KUV, ultrasonography, intravenous pyelography, computerized tomography, renal scale examination of stone, microscopic RBC, pus cells, cast, crystal, bacteriologically high important culture and sensitivity. Renal function test, blood urea, serum creatinine for the renal function. Prevention. Intake of liquid, especially water, should be increased. Drink enough fluid to achieve a urinary volume to 2000 to 300 ml or more every 24 hours. Drink large amount of fluid during the period of strenuous exercise if the patient perspired. Provide information about the reduction of dietary purines intake, low protein red meat, fish or fowls. Diet: avoid excess of the calcium and phosphorus. Maintain a low sodium diet. Limit animal protein. Eating too much animal protein such as red meat, poultry, egg, and seafood. Homeopathic management in the nephrolithiasis. In Organon of Medicine, Dr. Christian Francis Samuel Hahnemann sir has clearly stated in aphorism number 4 that he is a likewise the preserver of health. If he knows the thing that rearrange the health and cause the disease and how to remove them from the person in the health. Homeopathic medicine, Berberis vulgaris and Cantharis and many. Berberis vulgaris, the burning and soreness in the kidney region, stitching, cutting pain from left kidney following course of uterus into the bladder and urethra, renal colic, left-sided spacely bubbling sensation in the kidney, urine greenish, blood red with thick, slimy mucus, transparent, reddish or jelly-like sediment. Cantharis vesicatoria, constant urging to urinate, passing but a few drops at a time, which is mixed with blood, intolerable urging before, during, and after urination, violent pain in bladder, burning, cutting pain in the urethra during micturition, violence, tenesmus, burning pain, and intolerable urging to urinate is the red strand of Cantharis in all inflammatory affection. Conclusion: the renal stone is the most common disease of the urinary tract, also known as nephrolithiasis and renal calculi. The renal stone is one of the common disease of the urinary tract, also a homeopathic medicine frequently used in a treatment of nephrolithiasis, for example, Berberis vulgaris, Cantharis, Hydrangea, Lycopodium, Tabacum, Sarsaparilla, etc., and are giving very successful result. Thank you.
Thank you, Anjali Kushwaha, for a very good presentation. Now I request Akriti Gupta to start with the presentation on her topic. Next is Akriti Gupta, BHMS 4th year student.
Yeah, what I would suggest, just give me a minute. What I would suggest that
Yes,
students are coming and they are reading the papers and going. At least
Yes.
some questions must be asked. At least
Okay,
some
sir.
comments must be there. We don't have any session chair, or the session chair could not join on, so better. I would request to Sharma sir, kindly ask few questions, or you can ask till somebody is joining us. Okay. Thank
Yes.
you very much.
Thank you, sir.
Next presenter for presentation, please.
Yes, sir. We are starting with the presentation.
Next presenters, come and start presentation. Next student, please.
Namaste, Honorable Advisor, Sir and CEO, Sir, Registrar, Ma'am, respected Chief Guest, and all higher dignitaries. I, JVN Krishna Panchal from BHMS 4th year, JVU 193210. Topic: Homeopathic advancement in atopic dermatitis. Introduction. Atopic dermatitis, often referred to as eczema, it is a chronic, long-lasting disease that causes inflammation, redness, and irritation of the skin. It is a common condition that usually begins in childhood. However, anyone can get the disease at any age. Atopic dermatitis is not contagious, so it can be spread from person to person. Causes of atopic dermatitis. New research suggests that inflammation directly triggers sensation of itch, it, which in turn cause the patient to scratch. This lead to further damage of the skin as well as increased risk for infection with the bacteria. Changes in the skin barrier which help control moisture, change mutation in gene, problem with the immune system. Characteristics of lesions: erythematous and vesicles in children aged 1 year to older or older. Numeral patches may accompany the more typical dry erythematous scaling patches of atopic. Clinical feature: first, pruritus and itching; second, lesion typical or eczematous dermatitis; third, personal or family history of atopic; fourth, clinical course long lasting 6 weeks; fifth, lichenification of the skin. Diagnostic criteria: Hopkins and Rajka first proposed a systemic approach toward the standardization of diagnosis of atopic eczema by incorporating 3 major or 23 minor basic features. Major may pruritus, typical, morphological and distribution; chronic or chronically replacing dermatitis. Minor may xerosis, echetosis, palmar hyperlinear or keratosis pilaris, elevated serum IgE or recurrent conjunctivitis or many more. Atopic dermatitis is an endogenous eczema triggered by exogenous agent and characterized by extreme pruritus, recurrent symmetrical or eczematous lesion. Scope of future research. It is a therapeutic system of medicine premise of on the principle similia similibus curanter or let like be cured by like. It is a method of treatment for curing the patient by medicine that possesses the power of producing similar symptom in a healthy human being, simulating the natural disease, which it can cure. It is disease person. It treat the patient not only through holistic approach but also consider individualization characteristic of the patient. This concept of slow similia was also enunciated by Hippocrates and Paracelsus, but Hahnemann stabilized it on a scientific footing despite the fact that he lied in any age when modern laboratory method was almost unknown. Homeopathy is the largest system of medicine by WHO. Homeopathy medicine also used as a preventive medicine to prevent many epidemic and pandemic occur in society. Homeopathy medicine prevent the disease by improving the vital force and maintain susceptibility. Homeopathy is a complete and second largest used method of treatment by public. It is not only treat the disease but also prevent many epidemic and pandemic occur in society and prophylaxis medicine. People use homeopathic medicine as prophylaxis when different epidemic occur. Homeopathic prophylaxis medicine recently prevent epidemic of coronavirus, dengue fever, and chikungunya fever, etc. Homeopathic management. Some of the homeopathic remedy useful in cases of atopic dermatitis, eczema, as is follow. Sulfur. Atopic dermatitis with dry, scaly skin and itching. Burning worse by scratching, redness, especially from warm. Every little injury, suppurate, aggravate, washing, bathing night. Emulation by lying on right side. Second medicine, graphitis. Atopic dermatitis that appear in fold of skin. Eruption oozing out a sticky exudate. Rawness in the band of limbs, neck, ear, etc. Rough, hard, dry in portion of skin unaffected by eczema. Aggravation at night time, warm aggravation. Calcaria carp. Eczema of the children when it appear on the scalp with the tendency to spread downward and over the face. Frequently, it appear in patches on the face or scalp, forming thick crust which are often white like chalk deposit. Petroleum eczema, where whenever it may appear, forming thick scab and oozing pus. The skin soon grow more harsh and dry. There form deep cracks and
Conclude
fissures
it.
with
Conclude
evidence.
it. Conclude it.
And don't read line by line, just conclude it and, just tell.
Time limitation is there.
Okay, I think she is done. Am I audible to you, Aisha Ali ma'am? Yes. So, ma'am, first of all, I welcome you on behalf of entire management of Jayoti Vidyapeeth Women's University in our today's conference, Advancement in Homeopathic Research, including clinical trials, laboratory research, and case studies. And we are eagerly waiting to hear you, ma'am. We are eagerly waiting to hear your words about this conference. So, over to you. Thank you very much.
थैंक यू सो मच, थैंक यू सो मच। मैं भी आप सब लोगों का दिल से सबका वेलकम करती हूँ और आप लोगों ने मुझे इसमें बुलाया। इट्स सो नाइस एंड आप लोग का बहुत बहुत शुक्रिया।
थैंक यू मैम।
थैंक यू।
नमस्ते
बख्शी
मैम।
जी चले गए। नमस्ते
आ रहे हैं
नमस्ते
वापस लोग क्या?
बख्शी जी,
आ रहे
बख्शी जी चले गए। अच्छा अच्छा
कमिंग।
अच्छा, ओके ओके डन। इसमें काफी कम लग रहा है। असल में मैं लैपटॉप में खोलना चाह रही हूँ और इसमें बड़ा छोटा छोटा दिख रहा है मोबाइल पे, तो मैं लैपटॉप में खोल के देखती हूँ। यस वी कंटिन्यू। पंकज जी आ गए।
Namaste, ma'am.
नमस्ते।
Welcome to you.
Next
Now we are continuing with the presentation.
Already okay.
Our next presentation will be from BHMS 4th year student Azra Malik. So we'll be starting in a short while.
खुला इसमें?
Namaste. I am Jagan Asra Malik, pursuing BHMS fourth year. Pursuing BHMS fourth year. I am respectfully thankful to our advisor and CEO, sir, Jagan Vedant sir, and our registrar ma'am, Dr. Hima Bafla ma'am, and especially thanks to my dean and director sir, Dr. MP Sharma sir, and my mentor Dr. Rakesh Sharma sir, to giving me opportunity to propose project work at Jyoti Vidyapit Women's University, Jaipur, and giving us our support guidance. My topic is urinary tract infection. Introduction: urinary tract infection (UTI) is defined as the presence and multiplication of bacteria in the urinary tract. It is a common disorder accounting for 1 to 3% of the conclusion in general medical practice. The prevalence of UTI in women is about 35 at the age of 20, increasing by about 1% in each subsequent decade. It is an infectious that affects part of the urinary tract. Cystitis, when it affects the lower urinary tract, known as bladder infection, and pyelonephritis, when it affects the upper urinary tract. Cause of UTI: the urinary tract can become infected with various bacteria, but most common cause E. coli, derived from the gastrointestinal tract. Pathophysiology: urine is an excellent culture of medium for bacteria. In addition, the urothelium of the susceptible persons may have more receptors to which virulent strains of E. coli become adherent. In women, the ascent of organism in the bladder is easier than in man. Urethra is a shorter, and absence of the bactericidal prostatic secretion may be relevant. Sexual intercourse may cause minor urethral trauma and transfer bacteria from the perineum into the bladder. Risk factor for urinary tract infection: incomplete bladder emptying, included bladder outflow obstruction, benign prostatic enlargement, prostatic cancer, urethral structure, uterine prolapse, neurological problem, foreign bodies, urethral catheter. Risk factor for urinary tract infection: incomplete bladder emptying. Clinical feature: burning with urination, frequent urination, pain above the pubic bone or in the lower back, flank pain, fever, nausea, vomiting, rarely bloody urine, pus in urine. Investigation: urine analysis. Urine may be turbid, blood stained, and foul smelling. USG, plain X-ray, KUB, CT. Homeopathic medicine in UTI: polybacillum, inflammation of the entire urinary tract, frequent urination, passes small quantities at a time, sensation as if he must go again the micturate immediately after passing urine, dysuria, burning at the end of the flow, urethra, painful offensive urine, cantheris, cutting, lancinated, stabbing pain as from knives in neck of bladder, pain shoot off in different directions. Sarsaparilla is an excellent remedy for the urinary troubles. Urine may be scanty or copious, bloody or bright, and clear but irritating, flaky and sandy, passes without any sensation. Urine troubles with the sitting and motion passes freely. Thuja occidentalis. The patient described as a sensation of a dripping urine, intermittent urine with the sharp cutting pain at the end of the urination, and strong smelling, urine burning sensation in urethra, especially morning and during day. Nitric acid, nitric acidum. It is used for dark urine smelling like horse urine with a feeling of coldness in urethra during urination. Thank you.
आप अभी यहीं रुकेंगे, but student, you please be with us. Over to you, Pankaj sir, for your comment about this presentation of the student. If you would like to add anything or ask any question.
Every student done very well presentation. I am very much happy. They work hard, and I am asking to last speaker, Dr. fourth year student, for UTI.
Tell your name.
Why?
Your name. Student, tell your name.
Azra Malik.
Ajra Malik. She
Malik.
is Ajra Malik. Yeah.
Archana Malik, why don't you use pathological test in your presentation, before and after? like UTI, urine culture before and after.
आपने कल्चर रिपोर्ट क्यों नहीं यूज करी before?
When we are present our presentation, a case study should be before and after, and pathological test should be before and after.
सर मैं आगे से ध्यान रखूंगी मैं
यस और यस ये तो सही कह रहे हैं बिल्कुल शर्मा सर ने बिल्कुल सही कहा। और मैं ये भी कहूंगा अजरा जी, आप फाइनल ईयर में आ गए हैं, पीपीटी जब भी बना के लाए तो आपको यू डोंट नीड टू रीड लाइन बाय लाइन, यू कैन स्पीक, कैन टेक हेल्प फ्रॉम द पीपीटी एंड से इट योर ओन वर्ड्स। दैट इज द रियल मीनिंग ऑफ प्रेजेंटेशन, दैट इज द बेसिक पर्पस ऑफ ऑर्गेनाइजिंग दिस कॉन्फ्रेंस। ओके,
Very true.
so next time
Very true. Thank you.
okay, thank you sir. Next presenter, next student.
Thank you, Azra, for a very wonderful presentation. Now I request another BHMS fourth year student to start with her presentation.
No. Ravi, please listen.
Yes,
Hello.
sir. Yes, sir.
Now Dr. Aisha Ali will start.
Okay, sir. Okay, sir. We are stopping the presentation for a
yes.
short while.
Yes.
And we request our
Post lunch.
eminent speaker ma'am, Aisha Ali ma'am, to kindly
डॉक्टर बख्शी जी को आ जाने दीजिए। पहले डॉक्टर बख्शी जी आ जाएं। और अभी जो पंकज जी ने बोला उस बच्ची को बिल्कुल सही बोला, क्योंकि आफ्टर और बिफोर और आफ्टर जरूर टेस्ट होना चाहिए। और क्योंकि पंकज बिल्कुल इसमें एक्सपर्ट हैं और काफी अच्छी प्रैक्टिस भी है उनकी जयपुर में, तो ये गुड ट्रेडिशन। और बच्चों को अभी बच्चे जो प्रेजेंटेशन दे रहे हैं, इट्स ग्रेट प्रेजेंटेशन, गुड। अभी थर्ड ईयर फोर्थ ईयर के हैं, और अगर इनको अभी से इतना सब प्रॉपरली इनको आ जाएगा तो आगे जाके लोग बहुत आगे बढ़ सकते हैं। तो मेरा ये है कि डॉक्टर बख्शी आ जाए और सभी लोग आ जाए तो अच्छा है।
जी मैम,
तो मैम कंटिन्यू
प्रेजेंटेशंस कंटिन्यू करें हम लोग, एक दो
यस
presentations
प्लीज
Thank you, ma'am.
Please.
Now I request other BHMS fourth year student to start with the presentation. Akriti Gupta, fourth year BHMS student.
उसको बुलाओ ना, बुलाओ उसको उससे बुलवा दे।
Namaste. To respected advisor, CEO Jiven Sir Vedangar, and respected registrar ma'am, Himavapla ma'am, and our Dean and Director MP Sharma, and all respected chief guests, and all my higher dignitaries, and especially thankful to our former CEO, our late Dr. Pankaj Garg sir. IJV and Akriti Gupta pursuing BHMS fourth year from the Faculty of Homoeopathics and presenting on topic and endeavor to understand PCOS in homeopathic content. So here we start. Polycystic ovarian syndrome is a multiple system endocrinopathy with ovarian expression of metabolic disturbance and a wide spectrum of clinical features such as hypoandrogenism and obesity along with metabolic disorder.
Where is your presentation?
There are
PPT.
several causes including changes in lifestyle, diet and stress, genetic and familial environment factor, and alteration of gonadotropin releasing hormones.
Ravi,
These result in increase.
This is not giving the PPT.
अपना पीपीटी शेयर करो बच्चे, स्टूडेंट शेयर योर पीपीटी।
PPT दो बेटा।
करने दीजिए भी कंटिन्यू बेटा।
सर दिख रही है?
Yes, it is visible now. You can start.
Introduction. Polycystic ovarian syndrome is a multiple system endocrinopathy with ovarian
expression of metabolic disturbance, and a wide spectrum of clinical features such as hyperandrogenism and obesity, along with the metabolic disorder. Etiology. There are several causes, including changes in lifestyle, diet, and stress, genetic and familial environment factor, and alteration of gonadotropin releasing hormone secretion, resulting in increased luteinizing hormone secretion, and alteration in insulin secretion and insulin action result in hyperinsulinemia and insulin resistance. A defect in androgen and synthesis that result in increased ovarian androgen production. Insulin resistance result not only in metabolic disturbances but also in reproductive features through augmenting androgen production and increasing free androgens by reducing sex hormone binding globulins. Obesity increase hyperandrogenism, hirsutism, infertility, and pregnancy complication, both independently and exacerbation PCOS. Clinical feature. Patient complains of increasing obesity, chiefly abdominal 90%, menstrual abnormalities, oligomenorrhea, amenorrhea, or dysfunctional uterine bleeding. Hyperandrogenism appears in form of acne 30%, hirsutism, facial hair over the upper lip, chin, breast, and thighs. Hyperinsulinemia may manifest and actinogria 5% over the nape of neck, axilla, and below the breast. Other symptoms include exhaustion or lack of mental alertness, thyroid problem, psychological problem, emotional wellness issues including bipolar, turmoil, and gorging issues. Additionally, happens all over more regularly in ladies with PCOS. Investigations. Ultrasound is diagnosis of PCOS. Serum values, osteron E2 levels rises. LS level is raised over 10 ml. As SHBG levels fall due to the hyperandrogenism. Testosterone and epiandrogen level as testosterone less than 2 ng/ml free. Fasting insulin level is less than 25 microUL/ml and fasting glucose insulin. Prolactin is midly raised in 5% cases. 17 alpha hydroxyprogesterone in follicular phase. Insulin resistance and laparoscopy. Management. As in lifestyle disorders, so management of weight and lifestyle are considered as first line therapy. Increased daily physical activity, including aerobic exercise, yoga, can help to improve weight, insulin resistance, and cardiovascular fitness. Diet. Carbohydrate and fat quantities should be reduced in the diet. Cigarette smoking and alcohol should be avoided. Homeopathic view on PCOS. Dr. J.H. Allen stated that the sexual and reproductive organ of the women are not less free from the influence of miasmatic action in needed. They have a great center of both psychological, pathological, and therapeutic study for our profound consideration and more serious thought. So this is explains that the disease like PCOS is caused due to the combination of variable factor out of which the most common or suppression which can be reason behind abnormal growth. In aphorism 5, Dr. Henneman has mentioned the most significant point in the whole history of the chronic disease to enable him to discover the fundamental cause, the certain physical constitution of patient, especially when the disease is chronic. His moral and intellectual character, his occupation, mode of living and habit, his social and domestic relation, his age, sexual function are to be taken into consideration. In PCOS, first there is a Soric miasm, which causes the functional disturbance, followed by the involvement of psychotic miasm, which leads the cystic changes in the ovary. This combination of soric and psychosis led the hormonal imbalance and the cyst formation. Soric miasm involves symptoms, functional disturbances of ovary and uterus, amenorrhea of functional origin. Face has dry, itchy pimple and simple acne. Psychosis involve inflammation and cystic degeneration of ovaries and fallopian tube, etc. Hyperpigmentation in patches or diffuse in different parts. Homeopathic medicines, colocin. Boring pain in the ovary must be double with great restlessness, round small cystic tumor in the ovary or bored ligament wound abdominal supported by the pressure, bearing down cramp. Iodine. This medicine is indicated when the menses are irregular. Great weakness during menses, ovaries, breast pain like right ovarian region, anxiety and depression, sudden impulse to run and get violent, podophyllum platinum. Pain in the uterus and right ovary, pain extending in the shoulder, bearing down sensation in lower abdominal region, and genitals extending to the thighs. Pulsatilla. top grade female remedy with scanty menses, amenorrhea, menses too. Bovista. Indicated in the ovarian cyst with scanty menses, flow more during morning and less in night. Press. Thank you. Jai Hind, Jai Nari Shakti.
Any questions? Any questions?
Any questions?
रवि
Thank you, Akriti. Yes, sir.
बख्शी सर नहीं ज्वाइन करेंगे अभी। आयशा अली मैम को बोलो स्टार्ट करें।
आयशा अली मैम तो अभी है नहीं, मैं कॉल करता हूँ सर उनको, अभी मैं स्टार्ट। प्रेजेंटेशन अभी रोकना है या कंटिन्यू करें?
सर संजय उसमें गुप्ता उसमें है ट्रेन में, नॉट पिकिंग द फोन।
नहीं सर, shall I continue with the presentations or I have to wait?
आयशा अली मैम से पूछो एक बार।
मैं पूछ के बताता हूँ।
आयशा मैम ने तो बोला है ना कि वो एक बार जब बख्शी सर आ जाएंगे तभी बोलेंगे।
बख्शी सर नहीं आएंगे सर।
तो वो मुझे भी पता है कि नहीं आएंगे, तो लेट अस रिक्वेस्ट हर टू गिव द प्रेजेंटेशन, या जो भी अपने वर्ड्स कहने वो कहें, और तब तक एक अपना स्टूडेंट प्रेजेंट कर देगा जब तक वो आती है।
ठीक है।
So meanwhile, till Dr. Aisha Ali ma'am joins, I would request another one of our BHMS student to start with the presentation.
Yes.
Now I request Bushra Khan to BHMS 4th year student to start with the presentation. Over to you, Bushra.
Thank you, sir. Namaste, Honorable CEO and Advisor, sir, Honorable Registrar, ma'am, and all the respected higher dignitaries. I, JVN Bushra Khan, BHMS 4th year student from the Faculty of Homeopathic Science, has been presenting a PowerPoint presentation on the role of homeopathy in migraine. Sir, is it visible? It is a Migraine is a neurological condition that can cause multiple symptoms. It is characterized by intense debility and headache. Their triads are primordial vision, unilateral throbbing, headache, and nausea and vomiting. Trigger factor: genetic predisposition, high levels of estrogen, lack of sleep. Sign and symptom: nausea, photophobia, lightheadedness, vomiting, vertigo, usual disturbance. Diagnosis: a detailed history of headache and other symptoms, which include the following, has to be recorded: types of headache, age of onset, frequency and duration of attack, intensity of pain. Management: avoidance of stress, noise, odor, brightness, and flickering light extraction. Behavioral changes: avoid sleep deprivation, excessive sleep, medication, avoid oral contraceptive, hormones replacement therapies, and histamine 2 blockers. Homeopathic management: arsenic album causing a throbbing headache over the left eye. The arsenic headache is temporarily relieved by the application of cold water, natrum muriaticum. Headache comes in the morning or at 10 a.m. lasting up to 3 p.m. or evening. The headache is preordinally, it is by partial blindness sensation if there was little hammers beating in the skull primary, similarly to soul. Thank you.
Any questions?
Any questions, sir?
Your good name, beta?
Mushta Khan.
Mr. Khan.
Yes.
Uh, Mr. Khan, why don't you use eyesight vision, tumor for CT scan,
Sir, I said
eye
photophobia for that.
eye pressure? Migraine
Sir,
is the one. First
sir,
of all, you find out the causes. You don't prescribe a single medicine. First, you cause the what is the cause of the migraine, and then after you decide the diagnosis is the migraine. Then after the migraine decided, then you can take before investigation. After investigation, I have done this thing. I will give the natramure or whatever you like, spigelia, समथिंग एल्स बेलेडोना ग्लोनाइन वगैरह लेकिन ये आपको खुद को कॉन्फिडेंस होना चाहिए मैंने ठीक किया तो क्या ठीक किया मैंने पहले मेरे पास जो पेशेंट आई थी मैंने हिस्ट्री ली इन्वेस्टिगेशन ये किए उसमें इन्वेस्टिगेशन में ये चीज थी मैंने ये डायग्नोस किया और उसके बाद में मैंने ये मेडिसिन दी और मेडिसिन देने के बाद के अंदर मुझको ये पता चला कि ये बिल्कुल ठीक हो गया तो ये मेडिसिन इसलिए हम साइंटिफिकली इसको प्रूव कर सकते हैं खाली पढ़ने से काम नहीं चलेगा बेटा ठीक है क्या हुआ भाई हेलो क्या हुआ शर्मा साहब? हेलो?
Sorry for the inconvenience caused, sir. Today, after the rain, actually the internet is creating a lot of problem here at Jyoti Vidyapeeth Women's University because yesterday there was a big storm that hit Jaipur and there was heavy rainfall because of which these technical issues are arising today. And I'm extremely sorry for the inconvenience caused because of that. I think Dr. Aisha Ali ma'am has joined us. So, ma'am, if I'm audible to you, डॉक्टर आयशा अली मैम
बस जस्ट डॉक्टर आयशा अली 2 मिनट में ऑफिस पहुंच रही है, ऑफिस से ज्वाइन करती है। एक्चुअली मैं अभी ड्राइवर नहीं आया इसलिए लेट हो गई मैं।
नो
तो
प्रॉब्लम टिल दैट टाइम
मैं
लेट मी
ऑफिस,
कंटिन्यू द प्रेजेंटेशन।
हाँ ऑफिस पहुंच के मैं आपको ज्वाइन करती हूँ।
जी जी मैम, थैंक यू मैम। So till that time I request another BHMS fourth year student Sandhya to start with the presentation. So over to you, Sandhya.
Unmute yourself. Yes, yes.
I am Jebin Sandhya Kumari, pursuing BHMN fourth year student. I express my sincere gratitude to respected advisor sir and CEOs JBN Vedant Garg and Registrar Ma'am Dr. Hema Bafila for providing me opportunity to work under its guidance, and thanks to all higher dignitaries. I would like to express great appreciation to Dr. Dean Dr. JBN MP Sharma sir and my mentor associated Dr. Ravi Jain sir for their valuable constructive suggestion. My topic is role of homeopathic medicine in breast cancer. Introduction. Breast cancer is a malignant proliferation of epithelial cells lining the ducts or lobules of the breast. Breast cancer is hormone dependent disease. It is the most common, that is 30% of all cancers, and is the second next to lung cancer. Common cause of cancer, deaths in women. A breast cancer grows for 6 to 8 years before reaching a diameter of 1 centimeter. After that is double within a year. Women without functioning ovary who never receive estrogen replacement therapy do not develop breast cancer. Pathogenesis. Both genetic and hormonal factors play a role. About 5 to 10% of breast cancers are hereditary and occur in patients with mutation of BRCA1, BRCA2, AT, OR, TP53 genes. Prolonged estrogen exposure associated with early menarche, late menopause, and use of hormone replacement therapy has been associated with the increased risk. Other risk factors include obesity, alcohol intake, nulliparity, and late first pregnancy. Stages of breast cancer. Stage 0. Non-invasive carcinoma in situ. Having no evidence of cancer cells entering or spreading to nearly a healthy tissue. Stage 1. The tumor is up to 2 cm in size at this point and no lymph node implicated. Stage 2. Invasive. Occur when the tumor is 2 to 5 cm in size or cancer cell spread to lymph nodes under the arm on same side. Stage 3. Locally progressed. Has the tumor is breast and is more than 2 inches in size or has spread to nearby lymph nodes. Stage 4. Metastatic. The progress to other parts of the body, either close to far from breast, in addition to breast, underarm, and internal mammary lymph nodes. According to approach 20210, of psoriatic origin are almost all the those diseases
that I have above term one-sided, which appear to be more difficult to cure each consequence of this one-sidedness. All there is other morbid symptom disappearing as it were before the single great prominent symptoms of this character are what are termed mental disease. They do not, however, constitute class of disease sharply separated from all other since since in all other so-called corporeal disease, the condition of the disposition and mind is always altered, and in all cases of disease, we are called on the cure. The state of patient's disposition is to be particularly noted, along with totally of the symptoms. If we would trace or accurate picture of the disease in order to be able therefrom to treat it homeopathically with success. Homeopathic medicine for breast cancer. Carcinosinum. Symptoms: severe pain, hardness, or lumps in the breast. Offensive discharge from breast bleeding and pain in the breast. Corneum maculatum, heart tumor in the breast, severe pricking and stitching pain in the nipple. Symptoms get worse on deep breathing and walking, painful, heavy breast before and during periods. Phytolacca decandra, painful, hard breast, pearly sway on breast, hard nodules felt in the breast, painful or cracked nipple, inversion of nipple, discharge from nipples. Thuja occidentalis. Symptoms: lump in the breast, tearing, pain felt in all over the body and in the breast, sore and painful lump near the nipples. Sorinum, swollen breast, painful breast, sore nipple, and oozing of acrid fluid, burning, ulceration in the breast and nipples. Discharge is so acrid that it burn and excoriate the gland. Severe intolerable itching. Conclusion: breast cancer is fatal disease. Indian women need to be aware of both modifiable and non-modifiable risk factors for breast cancer to adopt appropriate practice for prevention. Homeopathy based on law of similia, cancer belongs to the psychotic miasm, which implies abnormal growth of cells in the body. Miasm is inborn tendency of an individual to contract a particular disease. Miasms also play an important role in the selection of suitable homeopathic remedy. Homeopathy treatment pinpoint of the disease underlying cause and attend to the patient by considering her physical, emotional, and psychological generals. Thank you.
Any questions?
Any questions, sir?
Yes, over to you, Sharma sir, if you would like to say anything about this, because this is a very good topic as far as I think in today's scenario.
यस 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 हाँ बेटा, आपका नाम क्या है?
संध्या कुमारी.
संध्या कुमारी. बेटा बेटा एक बात बताओ, ये मैलिग्नेंट है या नहीं है? आपको क्या इन्वेस्टिगेशंस करने की जरूरत पड़ेगी?
मैलिग्नेंट है, इन्वेस्टिगेशन कराएंगे, उसमें हमें देखने को मिलेगा
क्या
कि ये
क्या 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 इन्वेस्टिगेशंस होंगे उसके लिए? आपने कैंसर का डायग्नोज किया, आपने ब्रेस्ट कैंसर डायग्नोज किया, खाली सिम्टम्स के आधार पर स्टोनी हार्ट है, लंप है, ये है, उस चीज से थोड़ी कैंसर डायग्नोज हो जाएगा.
डायग्नोसिस कराएंगे हम. तो बायोप्सी
What are the parameters to diagnose a cancer, breast cancer?
सर बायोप्सी करा सकते हैं.
बायोप्सी ओके,
सीबीसी करा सकते हैं.
सीटी, हाँ सीटी स्कैन
सीटी स्कैन.
ओके. I am always telling you one thing, please correlate it with the pathology. Pathological tests are the more important to diagnose any kind of disease, before and after. You should do it, okay?
Yes, sir.
थैंक यू।
थैंक यू।
अच्छा एक चीज संध्या, एक चीज और बताओ तुम, इसमें मियाज्मेटिक डायग्नोसिस क्या रहा, इसमें कौन सा मियाज्म रहा प्रीडोमिनेटली प्रेजेंट?
सर इसमें सिफिलिटिक मियाज्म और वन साइडेड डिजीज है ये।
कौन सा?
वन साइडेड, फ्यू सिम्टम देखने को मिलते हैं।
ये कोई वन साइडेड डिजीज तो नहीं है ना, ये तो अपने आप में एक मेजर पैथोलॉजी है।
सिफिलिटिक मियाज्म सर।
बस और कोई सा नहीं होगा।
आप फाइनल में हो, आपको पता होना चाहिए डायग्नोस कौन सा होना चाहिए, मियाज कौन सा होना चाहिए, ये मियाजमेटिक डिजीज कौन सी है, सोरा सिफिलिस डायग्नो क्या है, साइकोटिक है या मिक्स मियाज में है, ये तो आपको होना चाहिए ना क्लियर।
सर पढ़ा था तो मिला था सिफिलिटिक मियाज्म से।
चला गया वो।
Anyway, thank you
केस
very
में
much.
थोड़ा सा होम्योपैथिक पॉइंट ऑफ व्यू से फोकस करना चाहिए, है ना? अच्छा किया तुमने।
सर आगे
Good.
ठीक है।
Dr. Aisha Ali ma'am, can you hear me? Yes, she is with us.
Yes, definitely. ऑफिस में आ चुकी हूँ मैं।
Over to you, ma'am, if you are ready for your words.
बोल रहे हैं अभी जो बच्चे हैं अभी एक्सपर्ट हैं, तो ड्यूरिंग पीरियड मतलब ड्यूरिंग अपना स्टडी चल रही है, फिर भी अगर इन लोग कर रहे हैं तो बहुत अच्छा कर रहे हैं बिकॉज ऑफ दी महावीर शर्मा जी जो प्रिंसिपल है। तो थैंक यू फॉर शर्मा जी, आपके बच्चे इतना अच्छा बोल रहे हैं, इतना अच्छा वो बना रहे हैं और इतना अच्छा बता रहे हैं, और पंकज शर्मा जी जो उसमें समझा रहे हैं ग्रेट। तो मैं अपने ऑफिस आ चुकी हूँ और आप सबको ज्वाइन कर लिया है। मेरा असल में लैपटॉप पे नहीं हो पा रहा है तो बहुत छोटा छोटा दिख रहा है मुझे। सबका मैं वेट करती हूँ, और ये सबसे ज्यादा इम्पोर्टेंट है महावीर जी जिन्होंने इस प्रोग्राम को अरेंज किया, और सारे लोग एक्सपर्ट इसमें बैठे हैं। बख्शी जी अभी आए थे, शायद किसी वजह से नहीं आ पाए हैं, तो उनके लिए भी वेलकमिंग है। वो हमारे इस कंट्री के महामहिम है उनका थैंक यू करती हूँ कि वो आए और शायद किसी वजह से नहीं आ पाए।
थैंक यू मैम। आप कहाँ चले गए?
सॉरी फॉर द
डिस्कनेक्ट हो गई
मैम, शायद डिस्कनेक्ट हो गई नेटवर्क इशू की वजह से। मैम इज बैक।
आ रही है
जी।
शी इज कमिंग बैक।
तो उन सब जो है एक्सपर्ट वो बच्चों को समझाएं और होम्योपैथी को प्रमोट करें, बिकॉज होम्योपैथी की जो रिजल्ट्स हैं, मेरे ये काउंसिल में हॉस्पिटल भी मैंने खोला है, तो जो पेशेंट है, जो आपका मेडिसिन है उसकी कोई बराबरी नहीं कर सकता। तो लेकिन इसके लिए अपन को एनाटॉमिकली नॉलेज होना चाहिए, आपका ऑर्गन मटीरिया मेडिका उसमें एक्सपर्ट होना चाहिए, कंटिन्यू मेडिसिन पढ़ना चाहिए, जैसे पंकज जी बोल रहे हैं पैथोलॉजिकल नॉलेज होना चाहिए, है ना। इसी तरीके से जब तक सारी नॉलेज आप इकट्ठा नहीं करेंगे बच्चे लोग, जब तक एक अपन पर्टिकुलर केस को नहीं सॉल्व कर सकते। तो सॉल्व करने के लिए आपको पैथोलॉजिकली मेंटल सिम्टम्स के क्या है, उसका एनाटॉमी क्या है, ये सारी चीजें जब आप देखेंगे तब इसका रिजल्ट देखेंगे। तो रिजल्ट के लिए आपको सारे प्रॉपर एनाटॉमी, फिजियोलॉजी और मटेरिया मेडिका मेडिसिन, तो इस चीज पे आपको बहुत ज्यादा ध्यान देना पड़ेगा। तो मैं आप सबका बहुत शुक्रिया अदा करती हूँ, और पंकज शर्मा जी जितने हमारे साथ बैठे हैं इस मीटिंग में, इन सबका मैं तहे दिल से शुक्रिया करती हूँ कि आपने मुझे इसमें मीटिंग में बुलाया। और बच्चे बोल रहे हैं, और बच्चों को भी अपन को बहुत पढ़ाना है, अभी बहुत लेक ऑफ नॉलेज है। नॉलेज के लिए टीचर्स को पूरा फुलफिल टाइम देना पड़ेगा बच्चों के लिए, तब बच्चे एक्सपर्ट होते हैं। और दूसरी बात, प्रैक्टिकल नॉलेज इज मस्ट। प्रैक्टिकल नॉलेज आप जो आपकी इंटर्नशिप होती है कॉलेजों में, उसमें जो बच्चों को सिखाया जाता है वो सबसे इम्पोर्टेंट है लाइफ। तो सबसे ज्यादा शर्मा जी इंटर्नशिप वाले बच्चों को बहुत ज्यादा उनके ऊपर, लेकिन लोग प्रॉपरली मैंने देखा मध्य प्रदेश में, ऑल इंडिया में, सब जगह इंटर्नशिप में कोई ध्यान ही नहीं देता है। सबसे इम्पोर्टेंट होती है इंटर्नशिप। इंटर्नशिप में बच्चों को प्रैक्टिकल नॉलेज दिया जाता है। प्रैक्टिकल नॉलेज अगर बच्चों को नहीं मिलेगा तो वो दूसरे फील्ड में चले जाते हैं। तो मस्ट है कि आप डेली उनको फर्स्ट ईयर से ही आप बच्चों को ट्रीटमेंट सिखाइए, पेशेंट दिखाइए, और पेशेंट को कैसे डील किया जाता है, उसके किस तरीके से कॉन्स्टिट्यूशन, क्या क्या कॉन्स्टिट्यूशन में क्या क्या अपन देखते हैं जब पेशेंट आते हैं, और उसके क्या क्या मेंटल सिम्टम्स होते हैं, कैसे हिस्ट्री ली जाती है, ये सारी चीजें बच्चों को सिखाना चाहिए। केस हिस्ट्री इज वेरी इंपॉर्टेंट। उसकी पूरी हिस्ट्री जैसे अपन उनको शुरू करते हैं हिस्ट्री, उनको सब चीजें दिखाना और सिखाना इज मस्ट। तभी बच्चा फुलफिल होता है। नहीं तो ऐसे बच्चे सिर्फ पढ़ के और निकल जाएं तो उनको होम्योपैथी का इतना प्रॉपरली नॉलेज नहीं होता। लेकिन मैं सभी बच्चों को बहुत थैंक्स करती हूँ, ये जितने बच्चों ने अभी बोला, बहुत सही बोला। यूटीआई पे भी, किडनी रीनल स्टोन पे भी, ब्रेस्ट कैंसर पे भी, इस ग्रेट बच्चे लोग पढ़ रहे हैं। और अभी जो लेटेस्ट बच्चे निकल रहे हैं, रियली वो काफी अच्छे बच्चे निकल रहे हैं, अच्छा पढ़ते हैं। और मैं आप सब बच्चों से यही उम्मीद रखती हूँ कि आप सब बच्चे बहुत अच्छे से डीपली पढ़ें, क्योंकि ये जो एक समंदर है, होम्योपैथिक का जो नॉलेज वो है, मेडिसिन है, ये बहुत ही डिफिकल्ट है चूज करना। इसको आप एक मेडिसिन कई सिम्टम्स पे काम करती है, तो उसको चूज करना बहुत ही डिफिकल्ट होता है। तो बच्चों को जब तक डीपली पढ़ेंगे नहीं, उसको समझेंगे नहीं कि एक मेडिसिन जैल्सीनिया में फीवर पे भी आती है, ब्रायोनिया कफ में भी आती है, कॉन्स्टिपेशन पे भी आती है, तो आप कैसे उसको डील करें, कैसे आप देखेंगे। तो ये सब चीजें बच्चों को बहुत जरूरी है कि मेडिसिन का नॉलेज होना चाहिए, फार्मेसी उसकी पक्की होना चाहिए कि कहाँ किस तरीके से एक्शन करती है, पैथोलॉजिकल नॉलेज होना चाहिए। तो मैं सभी बच्चों का बहुत अच्छा बच्चों ने बोला, और उम्मीद रखती हूँ कि बच्चे बहुत आगे बढ़े, बहुत तरक्की करें, होम्योपैथी का नाम करें। और आप सब लोग ने जिन्होंने इसको अरेंज किया है मीटिंग को, मैं ये चाहती हूँ कि मीटिंग हमेशा कंटिन्यू रहे, वीकली रहे, नहीं तो 15 दिन में तो एक मीटिंग होना ही चाहिए, जिससे कि बच्चे प्रमोट होते हैं। बच्चों को एक उत्साह रहता है कि हम अगर बोलेंगे तो हमारा कुछ नाम भी होगा, और समझेंगे भी और पढ़ेंगे भी। तो बहुत बहुत शुक्रिया मेरे प्यारे स्टूडेंट्स सारे, और टीचर्स एंड प्रिंसिपल एंड पंकज शर्मा जी और बख्शी जी, तो महामहिम, उनका थैंक यू कि आप उस मीटिंग में आए। और आप सबका बहुत, बीच में जरा सा ये इंटरनेट प्रॉब्लम आई थी, वो तो आती रहती है, उसके लिए कोई प्रॉब्लम नहीं है। आप सबका बहुत बहुत शुक्रिया। थैंक यू सो मच। आपको मैं अपना ऑफिस
मैम एक
ऑफिस
जानकारी देना चाहेंगे, मैम एक जानकारी देना चाहेंगे कि
जी
2023 से फर्स्ट ईयर में 6 सब्जेक्ट हो गए। पहले 3 थे, अब हो गए 6। एनाटॉमी, फिजियोलॉजी, मैट्रियामेटिका, फार्मेसी, ऑर्गनन और रेपर्टरी। ये सीबीडीसी प्रोग्राम करवाया है एनसीएच के द्वारा, जिससे फर्स्ट ईयर से ही बच्चों को ट्रेनिंग दिया जाएगा। रेपर्टरी का केस टेकिंग करना सिखाया जाएगा, और मेडिकल का जितना भी होना चाहिए, एनाटॉमी, फिजियोलॉजी, फार्मेसी, नॉट ओनली ऑर्गेनन ऑफ मेडिसिन एंड मैट्रियामेटिका को भी उसमें इंक्लूड किया गया है। और ये कोर्स हो गया 1.5 ईयर्स का, फर्स्ट ईयर का।
बहुत अच्छा है। और
it was suggested by the NCH। तो जो काम कर रहे हैं हमारी NCH, बहुत अच्छा
करवाना चाहिए, बहुत जरूरी था ये, क्योंकि बच्चों को इसका नॉलेज नहीं रहता है, वो बहुत जरूरी था, और ये सभी बच्चों के लिए बड़ा बेनिफिट रहेगा।
जी सर, जी मैम,
जी
थैंक यू मैम, आपने हमें संबोधित किया, उसके
देखिए
लिए मैं आपका बहुत बहुत
ये
शुक्रगुजार
लाइट
हूँ।
जला दो, सब लाइट जला दो। जी जी, बहुत बहुत शुक्रिया आपका भी। देखिए हमारा मध्य प्रदेश का काउंसिल दिखाते हैं आपको,
जी
जो
जी
बड़ा
बिल्कुल।
ब्यूटीफुल है। देखिए कैसे दिखाएं इसको, ये इसका कैमरा कैसे पीछे जाएगा?
फ्लिप कर दीजिए कैमरे का, नीचे वो
बच्चों
होगा
को दिखाएंगे, ऑफ हो जाता है। नहीं होता, कोई बात नहीं, ऐसे दिखाती हूँ, देखिए आप।
हाँ हाँ बिल्कुल बिल्कुल, मैंने तो देखा है मैम।
अरे आपने देखा है, सब बच्चों को दिखा रहे हैं कि
बच्चों
बच्चों
को
को भी
दिखाने
एक
के लिए
इम्पैक्ट
दिखा
होना
रहे
चाहिए।
हैं, बट
जी
स्टूडेंट्स कैन सी,
ये
ऑल दोज
बच्चों
हु
के
आर
लिए दिखा रहे हैं,
कनेक्टेड।
जी
ये
ये
एमपी
बच्चों के लिए
काउंसिल
दिखाया जा रहा है कि बच्चे,
होम्योपैथी का ऑफिस है।
ये बच्चों को प्रमोशन के लिए, प्रमोट करने के लिए दिखाया जा रहा है।
अच्छा
बहुत
ऑफिस है
सुंदर,
मैम, दिस इज
बहुत
गुड।
सुंदर।
थैंक यू।
बहुत ही अवार्ड है मैम आपके पास, मैनी अवार्ड्स इन योर ऑफिस।
और नीचे एक कमरे में और नीचे रखे हुए हैं, वो वाला कमरा भी भरा हुआ है। थैंक यू सो मच।
पंकज सर आएंगे तो उनको जरूर दिखाएगा, अभी बाहर आने वाले हैं।
जी जी, तो
Thank you,
ओके,
ma'am.
बहुत बहुत
थैंक यू वेरी मच।
थैंक यू सो मच।
Thank you, ma'am, for your blessings and the generous words that you shared with our students. आपकी इन बातों से उन्हें बहुत encouragement मिलेगा। हमारे यहाँ बहुत सारे बच्चे एमपी के हैं, and they are seeing you, and we have informed them that your signature will be on their registration when they will get.
थैंक यू।
So आपसे तो हमेशा जुड़े रहेंगे, पहले भी आप हमसे जुड़े रही हैं, हमेशा आपने हमारा बच्चों का मार्गदर्शन किया है, और आशा करते हैं आगे भी आप बच्चों का मार्गदर्शन ऐसे ही करते रहेंगे। मैं डीन सर से रिक्वेस्ट करना चाहूँगा कि अब लंच का टाइम हो रहा है, तो अगर सर अलाउ करें तो वी कैन एंड दिस सेशन एंड वी कैन अगेन रिजॉइन
एक
डीन सर।
मैं
हम
रिक्वेस्ट
लोगों का लंच
करूंगा,
कहाँ पर है भाई?
मेरी एक रिक्वेस्ट है आपसे कि मैं इस बार आपके यहाँ भोपाल डॉक्टर राकेश शर्मा सर को भेजूंगा, उनको आप
बिल्कुल
दिखाइए।
वेलकम।
हाँ, और
बिल्कुल वेलकम।
इनको वहां पर एग्जामिनर की हैसियत से भेजूंगा।
बिल्कुल बिल्कुल वेलकम,
ठीक है,
बिल्कुल
और
जरूर,
पंकज सर आएंगे आएंगे नो डाउट।
बिल्कुल।
हाँ
आप
रवि
लोग
जैन
के
जी,
लिए
हम लोगों का
तो
लंच का अरेंजमेंट कहाँ पर है?
मेरे आ जाइए ऑफिस में। ऑफिस ऑफिस में आ जाइए, आपको ले चलते हैं लंच यहाँ पर से।
आ जाए अभी अब हम लोग आपके पास।
बिल्कुल आइए, वेलकम। मैं तो हमेशा ऑलवेज ऑलवेज रेडी। आप सबके लिए तो मैं होम्योपैथिक, एक मेरा फैमिली है पूरी, चाहे आप जयपुर में हो, चाहे इंडिया में हो, चाहे बाहर हो, ये मेरी फैमिली है, और आप लोग मेरे फैमिली के मेंबर हैं, तो इसलिए आप लोग के लिए तो वेलकमिंग के लिए आई एम ऑलवेज रेडी।
थैंक यू
ठीक है मैम,
वेरी नाइस।
थैंक यू। पंकज सर
बिल्कुल,
आपने
बहुत
बहुत
अच्छा
समय
नेचर है
दिया।
मैम का।
थैंक यू सो मच
सर।
मैम
सो कैन
दिल की राजा हैं।
So I request permission from our dean sir to conclude this session for a lunch break. Sir, if I may announce about the lunch break in this session, and then we can rejoin
1
the session
o'clock.
at
1
1
o'clock.
o'clock. So
Okay.
thank you, Pankaj sir, for your gracing this occasion with your presence. Thank you, Rakesh sir. Thank you, Dean sir. Thank you, Aisha ma'am. And thank you, our president in charge sir, who will be remaining with us for the whole journey. So officially I conclude this first session now, and I request all the students and the faculty members to go for the lunch. And at 1 p.m. sharp, we will be joining with our new guest and the remaining presentations of the day. So it's time for lunch. Thank you very much. And we will be meeting again at 1 p.m. with the second session of this day one of this international conference. Thank you very much. Thank you. Namaste, sir. Myself, Dr. Ravi Jain, JVN Dr. Ravi Jain. On behalf of Jayoti Vidyapeeth Women's University, Faculty of Homeopathy Science, I welcome you, sir. Dr. Shashi Mohan Sharma, sir, one of our chief guests for the today's events. Welcome, sir. Welcome, sir. Our Dean, sir, is joining shortly, sir, and he will be there in a moment. Namaste, sir. I don't think that voice is reaching you, sir. Sir, am I audible to you, sir? Am I audible to you, sir? Am I audible to you, sir? Now I request our Dean and Director, sir, Dr. M.P. Sharma, sir, to please officially commence the session 2 of day 1 of our international conference on the topic of advancement in homeopathic research, including clinical trials, lab research, and case studies. Sir, over to you, sir.
The post-lunch, we will start our conference, international conference. So first of all, I am requesting to Honorable Advisor, come CEO sir, and respected Registrar Ma'am, and Pro-President Dr. P.K. Raghav sir. Dr. Shashimohan Sharma sir, our chief guest today's session, he is also attended. He is coming to attend our international virtual conference. Thank you, sir. Namaskar. अनम्यूट कीजिए सर, अनम्यूट.
शायद सर को आवाज़ नहीं जा रही है अपनी, जो भी हम बोल रहे हैं सर को आवाज़ नहीं जा पा रही है. It might be some network issues because he is connecting from London, and this is 8:30 a.m. in London at present. So there might be some problems, and shortly we will be joined by various eminent speakers of the day. So today's, let me first of all tell you about inform you about the eminent speakers of this second session. In the second session, day 1 of our international conference, there will be various eminent speakers, which includes Dr. Shashi Mohan Sharma, sir, our chief guest, who got disconnected just now, and shortly will be again connecting with us. The other eminent speaker includes Dr. D.K. Sonkar, sir. Dr. D.K. Sonkar, sir, is the president, National Homeopathy Medical College, Lucknow. And also we will be joined by Dr. Subhash Singh, sir, who is the director of NIH Kolkata, that is National Institute of Homeopathy, Kolkata.
He's our guest of honor.
He is the guest of honor. And at around 2 p.m., we will be joined by our special guest, Dr. Jayesh V. Singhvi, sir. And he is the chairman of Global Homeopathic Foundation. So, and also Dr. Praveen Kumar Sharma, sir, from Telangana. So these will be the guests who are joining with us shortly in this second session. So there might be some delay in starting this session as our guests are just joining. And so we will just commence the session after the guest joins. Namaste, sir. Sir, am I audible to you, sir? Dr. Shashi Mohan Sharma, sir?
डॉक्टर शशि मोहन शर्मा सर, क्या मेरी आवाज आ रही है आपके पास?
मुझे लगता है कि वो सुन नहीं पा रहे हैं आप लोगों को. I think he is not able to hear. Plus we are, because this is for sure that he is not muted. He is unmuted. Otherwise, when you mute, you see a sign here. उनका मेरे ख्याल से स्पीकर वगैरह काम नहीं कर रहा है. Can you hear us, शशि शर्मा सर? No. चलिए आप इनको कोई मैसेज डाल दो इनके. इफ यू हैव द नंबर हैंडी, एटलीस्ट ड्रॉप अ मैसेज और समथिंग.
जी सर, अभी इन्फॉर्म कर रहे हैं सर उनको.
हाँ,
जस्ट इन्फॉर्मिंग है.
दैट विल बी मच बेटर.
यस सर, यस.
Hello, Dr. Subhash Singh, Director NIH Kolkata. He is our guest of honor today. Very shortly, he is also joining.
आवाज बहुत कम आ रही है डॉक्टर साहब.
Now it is all right. बिल्कुल ऑडिबल है आप. नमस्कार.
नमस्कार डॉक्टर साहब, आवाज बहुत कम आ रही है.
हाँ, बस ऐसे ही चलने दीजिए सर.
मैं देख रहा हूँ प्रोग्राम, मगर आवाज कम आ रही है, पता नहीं क्यों.
नहीं, मेरी आवाज आ रही है आपके पास?
बहुत कम आ रही है, हल्की आवाज आ रही है. मैं सुन रहा हूँ, जो भी आ रही है बहुत हल्की.
धीरे बोल रहा हूँ सर.
सर आपकी आवाज हमें बहुत अच्छे से सुनाई दे रही है यहाँ पर.
तो अच्छी बात है, हमारी आवाज कम से कम आपको सुनाई दे रही है.
हाँ, नहीं बिल्कुल. आपका
प्रोग्राम. डॉक्टर साहब इतनी मेहनत कर रहे हैं, सक्सेसफुल शो होगा. मगर मैं ट्राई कर रहा था, मैं लैपटॉप पे चल नहीं रहा था. लैपटॉप मेरे सामने लिंक नहीं हो रहा था, तो मैंने फोन पर ही लिंक किया, अपने मोबाइल फोन पर
किया आपने. और अब हमें आपकी आवाज बहुत अच्छी आ रही है.
थैंक यू डॉक्टर साहब. मुझे ये नहीं पता नहीं लग रहा कि इंडिया से आवाज क्यों नहीं आ रही है.
इंडिया में आपकी आवाज आ रही है.
थैंक यू डॉक्टर साहब. थैंक यू.
लिसनिंग योर वॉइस.
थैंक यू डॉक्टर साहब. थैंक यू.
ओके सर.
मैं देखता हूँ प्रोग्राम, सुनता हूँ जितना भी हो सकता है. मैं मोबाइल फोन पे सुन रहा हूँ.
Thank you for joining, sir. Myself,
You
Dr.
say few words.
Few
words. You start your few words regarding our homeopathy case taking or our theme today.
I think Dr. Shashi Mohan Sharma sir again disconnected because of the network issue.
नहीं, मैं डिस्कनेक्ट नहीं कर रहा था, मैं हेडफोन लगा रहा था.
Thank you.
I can hear you now slightly better.
Thank you, sir.
Okay. Padma Nair is also attending. She is also on the line.
Very good. Welcome, Dr. Padma Priya.
Yes. Hello. Good morning. Good afternoon, everybody. Good morning, Sharma sir.
Welcome.
नमस्कार.
नमस्कार डॉक्टर साहब. नमस्कार. बहुत दिन बाद मिल रहे हैं.
जी, कैसे हैं शर्मा जी?
बिल्कुल ठीक हूँ डॉक्टर साहब.
बहुत दिन हो गए, हम लोग मिले नहीं.
कभी आइए लंदन. वेलकम. डॉक्टर साहब आ रहे हैं, आप आ जाए इनके साथ.
जी जरूर. थैंक यू वेरी मच.
नाउ आई कैन हियर डॉक्टर साहब. बिल्कुल परफेक्ट आवाज आ रही है हेडफोन से.
So may I request Dr. Subhash Singh sir.
MP शर्मा सर, आप वेलकम तो कर दीजिए अपने डायरेक्टर NIH कोलकाता डॉक्टर सुभाष सिंह
किया ना सर.
I welcome all of you, all of me, all my brothers in homeopathy, everyone there. Welcome to all. हमारे बड़े भाई साहब हैं डॉक्टर MP शर्मा साहब, ये और हम एक हैं, हम दोनों ही आपको वेलकम कर रहे हैं, सबको वेलकम कर रहे हैं जी, बहुत खुशी का दिन है
सर. आपका वेलकम है सुभाष सर. Now you start your keynote speaker. Today you are keynote speaker of our theme.
Sir, first of all, let me introduce you about these topic of the title of the conference. We are starting with the 2 days international conference on the topic advancement in homeopathic research, including clinical trials, lab research, and case studies. This is a 2 days conference that that Jyoti Vidyapith Women's University is hosting, and on the virtual ground. And in today, we are having our eminent speakers, and out of those, Dr. Shashi Mohan Sharma sir, he is the principal from Hahnemann College of Homeopathy, London. Our special guest, Dr. Subhash Singh sir, he is the director from National Institute of Homeopathy. Dr. Padampriya Nair ma'am, she is the professor of Hahnemann College of Homeopathy, London. So these are the eminent speakers. Few more speakers are here to join, but now I request Dr. Shashi Mohan Sharma sir to please shower some blessings to say a few words related to our conference. So please.
Thank you very much. I hope this conference, this work will help a lot of people learning homeopathy. As you know, India is number 1 in the world. Wherever I go, I tell India is number 1 in homeopathy. So I'm proud to associate with the Indian homeopathy, and in spite of me, in the United Kingdom, I always admire the work and efforts of all the homeopaths in India. They are doing the great job. So I wish you all very good luck and my full support. Thank you very much.
Thank you, sir. Thank you for the generous words. Now I would request Dr. Subhash Singh sir. He is very experienced in this field, and this is our great honor to listen to him for us as well as our student BHMS students. That he is gracing this occasion with his kind presence. So I request Dr. Subhash Singh sir, please, to say a few words in today's context. Thank you, sir.
Thank you very much, Dr. Jain. I hope I am audible.
Yes.
Yes, sir. You are audible, sir.
It is a pleasure for me to be here on this platform of Jyoti Vidyapith, who is organizing this virtual conference. And thank you for having me here. Well, today I just want to, this is a message mostly for the youngsters who are listening, that today on one side, homeopathy is going ahead with leaps and jumps. We are achieving new milestones, and we have proved our worth, especially during this COVID times. Once the government of India announced that as an immune booster we can take arsenicum album, the demand for this arsenic was so much that supply was totally dried up at one point of time. From NIH, I can say we have supplied to different government agencies, different defense forces, police forces, and we have also conducted some research projects. One I would like to mention here, that we know that the largest slum is in Bombay, and that slum has a very dense population. So once the COVID entered there, it was a big headache for all of the people, especially the government agencies who were looking after it. And then we conducted a distribution of arsenicum with the Corporation of Mumbai. We sent a team there, and about 19,000 family doses were dispersed. And interestingly, we have kept the statistics. Out of this total dispersion, the efficacy was 98%. Those who have taken the medicine, 98% of those who were living in that slum, they were not affected. That is something which speaks about the efficacy of homeopathy. This is one side. At the same time, we also have to be cautious and understand what is the real situation on ground level. The situation is there are some things which are very good, like people in general are accepting homeopathy. Patients are coming to homeopathy. Our outdoor OPD in Calcutta, we have a daily footfall of about 3,000 patients. And the recent which we have opened in Delhi, which was inaugurated by Honorable Prime Minister on 11th December 2022. And within this short span of time, it has a footfall of 400 patients per day. So people, the layman, the sick persons, they are accepting homeopathy. That is one good side. On the other side, we as homeopath, we have some more works to do. We have some more responsibilities. Because this is at the same time a fact that there are less admission in colleges. There are less jobs in total. And people are, those who are passing out, they are not having that much of confidence to start a clinic. They are looking forward to get a job. Whereas in any professional course, the first priority is always for the practice, the private practice. So somewhere they are lacking this courage, this starting initiation to have a practice. And as teachers, we all are somewhere responsible. We are not becoming the role model, or we are not giving them enough confidence, or not giving them enough clinical guidance. So I will take this occasion to talk to my youngsters who are the future of homeopathy, to tell them that whenever you pass out, job is good, especially government job is always good. But at the same time, you also should think that there are limitations to every job, every service. Whereas in private practice, sky is the limit. Like in every field, initially 1 or 2 years, there may be some struggle. You have to overcome that struggle and you have to just be there. And once you put up that courage to be in your place, that phase of struggle comes up. And to get good results, to be a good doctor, the only thing required is that you have to remember what you have studied, to remember what made homeopathy work. Once we do that, I am sure you all will be a very good homeopath and you will be well accepted in society as a first-class citizen. So with these words, I convey my good wishes, I convey my greetings to all those who have organized this program, especially Dr. Mahavir Sharma has been in regular touch with me. So my regards to him and my good wishes to all the youngsters who are listening. Just I'll request them, when you are a homeopath, be a homeopath as Hahnemann taught us. Thank you very much.
Thank you, sir, for the generous words. And these words are really encouraging, because most of the students who are listening to you, we have students from BHMS first year to BHMS interns, and also lots of people online who are listening to this program. And they are really encouraged by your words, because this is the real truth that you have spoken. The sky is the limit, and homeopaths are not thinking beyond the college life. So this is a very good thing that you have told them, and I really thank you, sir, for the generous words. And you have shown them that how much they can get from where they are starting from. So thank you, sir. Thank you, sir. And I just request one more message for our students. If you can convey any thing that they can incorporate in their lives, so that they can become a good homeopaths from your experiences, or anything, sir, please share it with them.
Thank you, Dr. Jain. Before I start with the message, I'll just request you that this online seminar is fine.
Yes,
but
sir.
as a teacher, unless I get the look into the eyes of my audience, I don't feel comfortable. So sometimes in future, please organize a real meeting, real conference, so that we can all be together, and then have an interaction with my youngsters. The
Yes.
youngsters, I would just like to say that suppose in NIH we have this large number of patients,
Yes.
and our doctors, our teachers, they are treating them. So what brings this patient to NIH? There is nothing special in NIH. Only thing is that the doctors here, they are doing homeopathy as it should be done. Because ultimately your results speak. there are only two things important. One, the result. Second is doctor-patient relationship. So I request you that when you are looking at a patient, when you are treating a patient, please think yourself as a privileged person, because there are so many doctors in a populous country like India. There are so many options, and out of that, the patient has come to you. So you are privileged. Second, he is sick person. He has come to you for help, and you have to give your best, because you have been trained for 5.5 years at least to be a homeopath as Master Hangman taught. So I always believe that if it has to be done, homeopathy has to be done, so it has to be done in line of hand. So stick to your original, stick to your book, be serious in your clinics, in your training part, so that you can gain the experience whatever is available to you. And when you start practice, you don't feel hesitant, you feel confident, and that confidence will be conveyed to your patient. Thank you.
Thank you, sir. Thank you
Sir.
so much.
Subhash sir, before thank you, just I want to request you, please, you visit one day to our Jyoti Vidyapeeth Women's University as a guest lecturer for 2 hours. Date is convenient for you.
Sharma ji, you have my word. You have my word. My problem is that Saturday, Sunday थोड़ा free होता हूँ. बाकी जब तक director हूँ, जिम्मेदारी थोड़ा ज़्यादा है.
Saturday we can do to sir Saturday.
You just give me 1 month notice, and any day, any time. Basically, I am a teacher, and I always love to impart whatever I have learned and share with my youngsters. So मेरा वादा रहा, आप जब भी बुलाएंगे मैं हमेशा आऊँगा. Thank you so much.
Saturday को रखूंगा सर. Thank you so much sir. आपने हमारी इंटरनेशनल कॉन्फ्रेंस में अटेंड करके हमारे यहाँ एज ए गेस्ट ऑफ ऑनर बन के हमारे विश्वविद्यालय को आपने अभूत किया है. Thank you so much, sir.
He is very popular and all love him. We respect him for his work, and he is the family of homeopathy in India. We all know the history of India and homeopathy linked to the family. So I am very grateful for him joining this conference and seminar. And we wish you someday you are in UK with us and share your knowledge with the homeopathy.
I will. God willing, definitely. Thank you.
Without doubt, India is number one in the world for homeopathy. I am proud to say everywhere I go, even in Canada, I told homeopathy is the best in India. We follow Master Hahnemann like he is our God, not like a scientist or a doctor. So we always respect Hahnemann like God. And nobody can say anything against him. If they can be, we fight with them like enemy. So we are the best homeopath in the world, all Indians, anywhere in the world.
मैं एक और बात शेयर करूंगा सर कि मैंने सर के साथ काम किया है. सर से मैंने बहुत कुछ सीखा है. डॉक्टर महेंद्र सर ने हमको बहुत कुछ सिखाया ऑर्गेनाइजेशन ऑफ मेडिसिन में, और ऑलवेज मेरे को सजेस्ट करते थे कि आप मेरी बुक खरीद लो और पढ़ो उसमें, देखो क्या दिखा है. रियली इट वाज वेरी नाइस.
बहुत एक्सपीरियंस, बहुत नॉलेज, बहुत ज्यादा रिस्पेक्टफुल, बहुत बढ़िया. वी मिस हिम डेफिनेटली.
सर आज्ञा दीजिए, थोड़ा दूसरे काम से निपट लो तब तक.
Thank you so much, sir. Thank you.
Thank you. Nice meeting you, Dr. Singh. Doctor.
Thank you, sir.
Wish you good luck. Wish you good luck.
Okay, sir.
We also have a renowned guest, Dr. Jayesh V. Singhvi, sir, who is the chairman Global Homeopathy Foundation, Chennai. He has also joined us here. And I also request Dr. Naya ma'am to please turn on the camera if possible, so that the audience can see her and to get some message from her. Dr. Padanpriya Nair ma'am, if possible, please address our students. She is driving actually. I think
just give me 2 minutes. I'll come back online in 2 minutes, because I'm driving. I need to park somewhere safely so that I can.
No problem, ma'am. No problem.
Be safe, Dr. Padma. We need you.
Very nice, ma'am.
Sir, Dr. Shashimohan Sharma, sir, I just request you to kindly give some insight to our students. It has always been our pleasure to listen from you, to to listen good things from you, to learn lot of things from you. In the past also we have learned lots of things from you. So
My
if possible,
suggestion is we must believe and trust Hahnemann and follow his homeopathy properly, as mentioned in the Organ of Medicine and Chronic Disease and Philosophy. We never fail if we follow Dr. Hahnemann's principle. He said, you will never fail. The sun may rise in the west, but homeopathy will never fail. These are the words from Hahnemann. And I'm proud to be associated with the Hahnemann's family. Our college patron is Mr. Charles Tankar Hahnemann, the seventh generation grandson. And he is also very happy that we are doing the best in India. I brought him twice to India, and he was surprised to see the millions and millions people following homeopathy, and hundreds and thousands of doctors, and their education, their quality, their standard, their practice is remarkable. And he is very proudly saying, we love India for homeopathy, and India is keeping the tradition of my family, going on. So that's why we should always trust and follow Dr. Hahnemann's principles. It will never fail. I remember at one place he said homeopathy is as simple as a line is drawn between the two given points. One point here, one point there, and the line is totality of symptoms and case taking, matching the symptoms with the remedy and giving the remedy. It's so simple. No matter what disease is there, there is no need of diagnosis, there is no need of giving the name of any illness. If you found everything in one case, you make a note of it and match a remedy and give the proper remedy, the basis on the similmum, the patient will be cured. So that's why we have got the best formula in the world. This technique is not adopted by any science in the world, because if we take a case about 20, 100, 2000, any number of patients or any number of doctors taking a similar case, the remedy will be the same. If there is a case of arsenic album, it will be arsenic album. It can't be sulfur, lycopodium, or naxomica. Whereas in allopathy, the medicine is different, salts are different. The cause and the remedy never match. They give medicine to suppress the symptoms, whereas we give the medicine to cure the disease. So that's why we are the most superior, not only superior, most superior in the world for treating patients without any side effect or any problem. So that's why I say, please believe in homeopathy, carry on the traditional homeopathy. You can say it professional, classical, so many things, but I think homeopathy is only homeopathy which I follow. I don't name it a traditional or conventional or whatever, classical. Hahnemann's homeopathy, what he teaches, he is the only master. There are so many other doctors in the world, they are teaching homeopathy, but I truly follow my master and I never failed. So I give you this confidence to my youngster and new generation of homeopath. Only believe in Hahnemann. Don't listen to some. You may follow Dr. Kent, Dr. Boning Hassan, Dr. Nair, Dr. Lippe, but they all going on with the Hahnemannian homeopathy. There is a best suggestion that follow, study organon, go with the totality of symptom. There is nothing else which can give you the direction and selection of a remedy. You can only select the remedy on the basis of the totality of symptom, and each symptom should be complete in itself, like onset, sensation, location, concomitant. So these things are not known by allopathy doctors. They treat disease, we don't treat disease, we treat the patient who is sick. So that's my message. And I wish you good luck, and I'm very happy everything is going fine. I think Dr. Padma Priya Reddy, she's also very good homeopath, and she's well respected in United Kingdom, and I treat her like my family member. Dr. Padma Priya, go ahead, now is your turn.
Thank you very much, Sharma sir. A big fat namaskar to all the dignitaries present there today, and a big fat hello to all the passionate homeopaths who have joined this forum today. So, firstly, thank you very much. It's a great privilege to be a part of this event today. So, I really thank the organizers to include me in this panel. And before I start, I really would like to congratulate the university for taking this initiative, because it's actually a great privilege for the students to see all the pioneers all across the globe in one single platform. So it's a great initiative taken by the university. And I would also like to congratulate all the students attending, because trust me, students, you guys are the most privileged homeopathic students of the era. Because during our days, we used to really wait to listen to great pioneer teachers. We used to wait for seminars to happen in our area, because we cannot commute to distant locations to hear distant speakers. But we used to really long for the great speakers to come down to our city or to our college. So it's actually a great privilege. It's a greatest blessing of this COVID era for the students to listen to so many masters together in one platform. So students enjoy and take this opportunity to learn, because actually the organizing committee is taking a hell lot of effort to bring all the masters together under one platform. So with this, I close my note here. I'll be coming back tomorrow with a proper session. So thank you very much, and thanks to all the organizers again.
Thank you,
Bye.
ma'am. Thank you so
Thank
much.
you very
But
much,
Bye.
this
Thank
is
you
not
very
the
much.
complete thing that
And we are meeting for
expecting.
tomorrow.
Yes, yes, we are waiting for her
Start.
script lecture. Thank you, Dr. Padma Priya.
Thank you, ma'am.
Thank you, Sharma sir.
So now over to you, Dean sir. Can we start with the presentations now, or
No, वो संघवी साहब आ रहे हैं ना, जय संघवी.
We have given the time to Jayesh sir for 2 p.m. I think he will be joining at around 2 p.m. If he comes in between, then we will.
Yes, we can do. We can do start.
Now
Presentation.
I request our guest to kindly, if I can proceed with the presentation of the students, presenters. Sir, can I start with the presentation of the students now? The presentations.
Sashimohan sir. Sashimohan sir.
Yes, sir.
You please remain here with us.
I will remain at maximum time, but after my 1 hour is over, then I will rejoin it every 1 hour.
Okay.
Okay.
Start.
Okay.
Now I'll be starting with the presentations from our BHMS 4th year students who will be presenting their PPTs now. So now I request Samriddhi to come here and present her PPT. First, BHMS 4th year student Samriddhi Gaur.
First of all, you unmute yourself. Voice is not coming.
Namaste, sir.
Yeah.
Namaste to all the respected advisor and CEO JVN Vedant sir, respected registrar JVN Hema Bafila ma'am, and our respected chief guest and all the higher dignitaries, and my dear JVN. I, JVN Samriddhi Gaur, pursuing BHMS 4th year from the Faculty of Homeopathic Science, presenting on the topic role of homeopathic medicinal system in the management of insomnia. Insomnia is difficulty falling asleep or staying asleep even when a person has the chance to do so. Person with insomnia can feel dissatisfied with their sleep. Insomnia tend to increase with the age and is more prevalent among the women. There are different types of insomnia. First of all is primary insomnia, which means the person is having problem in sleeping and it is not related to any other health condition. Secondary insomnia is having trouble sleeping because of health conditions or substance like use of alcohol or any kind of drugs. The third is sleep onset insomnia. It is trouble getting to sleep, which means the person is having difficulties in falling to the sleep. But when he falls to sleep, he can maintain it. The fourth one is sleep maintenance insomnia. It is when the person is having trouble staying asleep through the night or wake up too early. It means the person falls to sleep very quickly, but he cannot maintain it. A small amount of noise can wake him up. Then there is mixed type of insomnia. In this, the person has problem both falling asleep and staying asleep throughout the night, which means the person is not able to sleep quickly. He stays in bed awake and thinking about several thoughts. If he falls asleep, he gets wake up from a very small amount of noise also. Then there is paradoxical insomnia, when the person starts underestimating the time they are asleep. They feel like they sleep lot less than they really do. It's when the person is sleeping for more than 8 hours or 10 hours, but he feels like he's sleeping for very less amount of the time. Then we have different causes for the insomnia. The primary causes of insomnia include stress, which can be due to any life event or emotional stress or any kind of exam stress and all. Secondly is noise, light, and temperature. The third is changing your sleep schedule. If the person is having a work profile where he has to change his duties regularly, so that changes his sleep schedule. Third is genetic causes, where it is seen that the parents are also very late sleepers. The secondary causes of insomnia include mental health issues like depression. Then second is medication for cold, allergies, depression, high blood pressure, and asthma also cause insomnia. Pain or any kind of discomfort at the night, which can be caused by any injury or bad or the environmental changes. Then the caffeine, tobacco, or alcohol use, as well as use of illicit drugs, also cause insomnia. Hyperthyroidism and other endocrine problems also cause the insomnia. Other sleep disorder like sleep apnea or restless leg syndrome causes the insomnia. Pregnancy, premenstrual syndromes, and menopause is also a cause of insomnia. Alzheimer disease and other types of dementia. कहाँ से वापस
स्लाइड गया से नीचे से पूरा स्लाइड
सर कहाँ से स्टार्ट करना है Prevention. So we were talking about the preventions. Sir, am I audible to you? Hello? Sir?
Yes, you are audible.
Okay,
Keep
sir.
presenting.
So I will continue with the preventions of insomnia. The good sleep habits can help prevent insomnia and promote sound sleep. Keep the bedtime and wake time consistent from day to day, including weekends. And we ask the patient to stay active. Regular activity helps to promote good night sleep, which are like physical activities, playing sports and games, checking medications, because some medication including the insomnia. And we asked him to avoid or limit the naps. The daytime naps also contribute to the night insomnia. Avoid or limit caffeine and alcohol, and don't use nicotine. Avoiding large meals and beverages during bedtime because they create insomnia. Creating a relaxing bedtime ritual such as taking warm bath, reading, or listening to soft music. Now there are some homeopathic medicines which can be used for insomnia. First of all is Calipos. Calipos is indicated when the insomnia is due to stress or worries. It helps when the insomnia is during the later part of the night. In this we have excessive yawning, extreme fatigue, both mental and the physical level, and sudden waking up from the sleep. The second is Porphyria cruda. In this, insomnia is arising from the constant thought in the mind during bedtime. Many ideas crowd the mind. The person remains restless at the night and experience sleeplessness, tossing from side to side. The third is Initia amara. Insomnia in this arises from the grief and depression. In this, the person has the desire to be alone, tearfulness, and sadness with the deep sighs. The person keeps thinking about the sad occurrence in the past. The Natswamika. Natswamika, in this insomnia insomnia during the later half of the night. During daytime, intense drowsiness, tiredness, and weakness appears. Has no trouble falling asleep, but wakes up around 3 a.m. and 4 a.m., after which sleep becomes difficult. And the last one is opium. Person is sleepy but unable to sleep. Remain awake for long. There is restless at night. It has constant tossing with the tumbling in the bed. The person may have acuteness of hearing, and small noises may disturb the person and cause sleeplessness. So we come at the conclusion. So insomnia is highly prevalent, affect approximately 30% of the general population, and this ratio is increasing rapidly due to faulty sleep habits. It is a lifestyle disorder and not a disease condition. It is one of the commonest reasons of workplace stress, mood disorders, eating disorders, inconsistent behavioral patterns. It affects the quality of life in a long term. So it should be treated properly as soon as it is diagnosed. And it can be prevented and taken care by taking care of the day-to-day work routine and having a healthy lifestyle. It is seen that homeopathy works really good in it, and it is a great support for the people who are diagnosed with it, with some lifestyle changes. Thank you, sir. Sir, and questions, any kind of questions, sir?
हेलो नमस्ते.
Yes, sir.
थैंक यू बेटा, थैंक यू. हाँ मैम नमस्ते. कहाँ हो मैडम आप? अरे यार डिपार्टमेंट में क्यों बैठती हो? सारे लोग रेखा गोविंद में बैठे हुए हैं.
Thank you for this wonderful presentation. Now we have another BHMS
कल ही बोल दिया था ना आपको कि रेखा गोविंद में आना है.
who will be presenting her.
आप कहाँ बैठोगे बोलो?
So now I'd like to request JVN Kiran to come on the dais and to speak about her presentation. JVN Kiran, BHMS 4th year.
One more thing, let me tell all those who are connected here, especially in this StreamYard, that this conference is live on YouTube.
Yes.
So you have to be very careful. Thank you.
Yes.
Namaste, sir. Namaste, I JVN Kiran Chaudhary, pursuing BHMS 4th year student. I express my sincere gratitude Gratitude to respected advisor and CEO Sir Devian Vedant Garg Sir and Honorable Registrar Ma'am providing me opportunity to work under his guidance. I would like to express great appreciation to Dean Sir, Javian, Dr. M.P. Sharma Sir, my mentor, Associated Professor Javian, Dr. G. Jesse John for their valuable constructive suggestion. My topic, role of homeopathic medicine in cases of tonsillitis. Introduction. Tonsillitis are two little masses of tissue along the edges of the throat. Its capacity is to protect the body against harmful substances that are found in the blood. Tonsillitis is an enjoying illness that is bound by a kindnate tonsils. The aggravation is because of disease or because they are loaded up with foreign substance. Definition. Tonsillitis is aggravation of the tonsils regularly of the fast beginning. It's a sort of pharyngitis. Side effects may incorporate sore throat, fever, extension of the tonsils, inconvenience, looping and herbs around the neck, difficulties incorporate pretonsillar concave. Etiology. Acute tonsillitis caused by bacteria virus. Recurrent tonsillitis caused by bacterium acetinomyces. Chronic tonsillitis caused by bacterial infection. Pretonsillar abscess caused by bacterial virus. Clinical manifestation: swelling, pain in the throat or severe sore throat, ear pain, painful, difficulty swelling, fever, chill, headache. Pathology: cause bacteria and virus enter through the nose and mouth, filter in the tonsils. Infection take place, it's active the white blood cell. Inflammation, pharynx, sign and symptoms are produced, fever, painful voice, abuse, tonsillitis. Homeopathic medicine, belladonna. Belladonna has the best anti-inflammatory action and thus helps lots of relief and symptoms both in acute and chronic condition. Mercurius solvers. The his samples to prescribe tonsillitis are pain in the throat, congestion of the tonsils, and unable to drink or eat anything. There is more salivation, more from mouths. Uh, Phytolacca. It is also one of the important medicine and in tonsillitis. The tonsils are dark red or bluish red in color. There is much pain in the root of tongue, soft palate. Hipper sulf. Hipper sulf is one of the best homeopathic medicine for tonsillitis. The tendency to suppression is most marked and has been strong guiding symptoms in tonsillitis. Calcarea card. It is a medicine for chronic tonsillitis problem. The person is bulky, obese, gaining weight easily. He is throat fatty but very weak in stamina, exhausted or tired or slightly physical activity. Conclusion. Intermittent or interminable tonsillitis is, as of the now worldwide general medical problem which can seriously weaken personal satisfaction. Microbial biofilm are a significant reasons for rehazard tonsillitis in both pediatric and grown-up companion, and more research is expected to grow new treatment methodologies, treatment modality out any way to founded on causation, determination, and individual thoughts of the potential effects of biofilms or instead of intermittent tonsillitis, as opposed to creating a utilizing increasing instant antimicrobial specialist outing of um, degree, or they are in the know regarding research and the treatments of biofilms. Thank you. Any questions?
Thank you, Beta. Thank you.
Thank you, Kiran, for a very wonderful presentation. Now I request our new student from BHMS 4th year, Yamini, to start her presentation on today's topic. So next, JVN Yamini, BHMS 4th year, will be coming to present her case.
Namaste to respected advisor and CEO sir, JVN Vedant sir, respected registrar JVN Hema Ma'am, and our respected chief guest and all the higher dignitaries and my dear JVNs. I am JVN Yamini Goti, pursuing BHMS 4th year, the Faculty of Homeopathic Science. My topic is obesity and homeopathy.
Where is your PPT?
Degree is it a Namaste. Obesity and homeopathy. Definition: obesity is clinical condition in which there is a excessive amount of body fat. The normal amount of body fat is expressed as percentage of body fat. It between 25 to 30% in women and 80 to 23 in men. Women with over 30% body fat and men over 25% body fat are considered obese. Etiology: causes of obesity, overeating, environmental factors, medication, family history, lack of exercise, genetic, pregnancy. Classification of obesity according to BMI, according to cause, primary obesity and secondary obesity, according to body shape and fat distribution, gynoid obesity and android obesity. Clinical features: excessive sweating, double chin, excess fat deposition in abdomen and waist, breathlessness, feeling tired after any physical activity. Diagnosis: history collection, physical examination, measurement of obesity, laboratory examination, fasting lipid profile, liver function test, thyroid function test, fasting glucose and hemoglobin A1C. Treatment: lifestyle modification, pharmacology or surgical treatment, bariatric surgery. Homeopathic management: graphitis prescribed when the woman gain excessive weight around menopause, even during the young age. The female have delayed menses. Lycopodium clavatum, very effective for those who gain excessive weight because of thyroidism. Phytolica berry, one of the best homeopathic remedy and mainly given to those who excessive weight. Thank you.
Any questions?
Any questions, sir?
No, thank you. Thank you. Thank you.
Now let's welcome
Jayesh
guest.
V.
Sir,
Sanghvi
please.
sir,
Yes.
I
Yes.
welcome to you in international virtual conference at Jyoti Vidyapeeth Women's University, Jaipur.
Yeah.
Please,
Thank you,
sir.
Dr. Sharma.
You are
Thank
the
you.
keynote speaker today.
Yeah, all right.
Okay.
Thank you so much, Dr. Sharma. Thank you for inviting me for this presentation. And I thank Dr. Praveen, I think, who referred my name. I am a clinician through and through, not a teacher exactly, but I'm going to share my 40 years of clinical experience where I'm going to talk on one of my most favorite subjects, miracles and magic of the minimum dose. Where I'm going to tell this whole presentation will be like a story. where the gist of the case will be told. I'm not going to go step by step, rapid writing. I'm not going to do that. But I'm going to teach the audience on how the simplest of prescriptions can be made for some of the most challenging cases. And I truly hope that it will be beneficial to all our doctors, students, and friends. Now we can begin the presentation, please.
Yes.
Do I have to monitor the presentation, Dr. Sharma?
This is the presentation, sir.
The presentation has been sent.
So is it visible, sir? Your presentation? Can you see
No,
this
I
presentation?
can't. No, I'm not able to see. I'm sorry.
Just a second, sir. I have shared the presentation with you. Let me again check, sir. Whenever it is visible, please inform me, sir.
Sure, just one moment. I will just.
Is it visible now, sir?
No, it says you have no slides.
This is the first slide. Let me, technical team, please help me with this presentation. Because I have shared this particular thing with this PPT. Can you see this presentation, sir? Dr. Jayesh, sir?
No, I'm able to see only all of us, you know. I'm not yet. Okay. I will do one thing. I will give my earphone to my assistant. She has a better idea of this technical knowledge. I am not so good at it. One moment.
Sir, can you see
No,
the PPT?
it came up again. It is going back. It was there.
Let me again share it with you, sir.
Yeah, up it. This, yes, it is there, and now press F5 probably. Yes, it is full screen now.
Okay,
good job. So, magic and miracles of the minimum dose. You can request him to present now. Me.
Dr. Jayesh, sir, can you hear me, sir?
Yeah, unmute yourself, Dr. Jayesh. We are not able to hear you.
Dr. Jayesh, sir, I think he got disconnected. Dr. Jayesh, sir? I think Dr. Jayesh, sir, got disconnected. I've shared the PPT actually. We are trying to connect with Dr. Jayesh, sir. Just hold on for a moment. डीन सर प्लीज आप एक बार डॉक्टर जयेश सर से बात कीजिए, शायद वो डिस्कनेक्ट हो गए हैं. Dr. Jayesh sir has sent us the PPT and we have tried to share the PPT from our side, and I don't know how he got disconnected. And about Dr. Jayesh sir, Dr. Jayesh V. Singhvi sir is the chairman of Global Homoeopathic Foundation in Chennai. He will be joining shortly with us, and he will be sharing the knowledge, his immense knowledge with us. So,
yeah, you are right. He looks a good speaker. I just I can see. So yeah, he was pretty confident also.
I have shared. Sir, can you see the PPT on screen, sir? Dr. Raghav sir.
Yes, sir.
Yeah, I'm seeing it. PPTs are very well here now. Don't disturb the PPTs. Better you should get in touch with Dr. Jayesh and you need to tell him that he got disconnected.
सर, डॉक्टर जयेश सर कुछ टेक्निकल कारण से हट गए थे, लेकिन वापस जुड़ रहे हैं.
Okay, all right, good.
No volume.
Dr. Jayesh sir has joined now.
Yeah.
Can you see the PPT now?
Yeah, I can hear you now.
Okay, sir. Can you see the PPT, the PowerPoint
I
presentation?
can see the PPT.
Okay, sir. Just tell me when to change the slide, and I'll change the slide for you, sir.
No, now it is very clear. Very clear. Yeah. I'm sorry for the confusion there. So, like I was, shall I go ahead?
Yeah.
Yeah.
Jayesh sir, can you hear us, sir? Dr. Jayesh sir?
Yeah, the screen suddenly went blank. Now it has come back again. Can you hear me?
Yes, sir, I can hear you, sir.
Okay.
Please tell me when to change the slide, sir. I will change the slide.
I'm sorry, your name, please?
Dr. Ravi Jain, sir. Myself, Dr. Ravi Jain.
Dr. Dhananjay.
Ravi,
Yes.
R-A-V-I.
Dr. Ravi, okay.
Yes, sir.
Yes, Dr. Ravi, yes. So, shall I go ahead now with the presentation?
Yes, sir. Yes, sir. Definitely.
Yes, sir.
So once again, a very good afternoon to all of you, dear doctors, students, and friends. I'm going to talk from my 40 years of clinical experience, where I have worked out some of the most simplest applications of the most common remedies to treat some of the most challenging cases. And I'm going to explain the clinical side on how you too can become, you too can select some of the most common remedies and treat some of the most challenging conditions. We'll move to the next slide, please. Yeah, I begin with my most humble obeisance to all my gurus. For all of us, it begins with Dr. Samuel Hahnemann, the founder of homeopathy. And then my next three gurus who changed my life and my attitude towards homeopathy. First is Dr. R.P. Patel, world-renowned legend and a man of multiple talents who rediscovered the 50 millisimal LM potencies, who discovered the tautopathic medicines, who rewrote Kent's repertory, and so on. He has innumerable successes. And he is also the gentleman who maybe has treated the largest number of cancer cases in the history of homeopathy in the world, with remarkable cures. I have seen it from my college days. The next is Dr. S.P. Kopikar, another legend who was known nationally and internationally across the world. And then we have Dr. P.S. Krishnamurti of Hyderabad. So these are three gurus who motivated me, and I shall never forget it. Now, I would like to share with you the mantra of my life. Friends, here my whole concept of talking over here is to make make you more successful in your practice by sharing my experience. Every successful homeopath has his experiences to share. I'm going to share a lot of it here. And it begins with my mantra. I always believe that there are the simplest answers to the most complex situations in life. And all we need to do is believe so. We are from childhood, we are taught that the more complicated a situation, the more complicated a case, the more difficult an answer to it or a more difficult solution. It is not so. So it all begins with the faith, and have faith in this system of medicines, which is a remarkable medicine. Believe me, if you are a homeopath, keep your faith, build your faith day by day, and you will create more and more miracles in life. I'm going to talk about single dose simplified prescriptions. Next slide. Now, this is a case that came to me sometime in 1991, if I recall right. I received, those days we never had cell phones and all that. I received a letter, a 5-page letter from this lady from Malaysia. 2 of the pages were smudged. The ink was smudged because she was in tears. Those tears had smudged her writing, some of her writing. The gist of the whole story was that she had been suffering from unbearable abdominal pains, and for which she had gone through 6 different surgeries. She went from Malaysia right up to the US. All possible prescriptions. Somebody said over this, somebody said there is this thing with the intestine, interception of the intestine. So 6 different surgeries done. The pain only became worse. Twice she went to commit suicide. Once a priest saved her. The other time she came back because she had a 10-year-old son. She said, who will look after my son? She came back. And somebody had spoken about me. She wrote this letter. She said, doctor, this is my last hope. If you wish, I will come down. I'm in such problems, such unbearable pain. Even injections, the best of painkillers, nothing would help her. She came in, we took the history. I spent about 1.5 to 2 hours with her. My first session with the patient is always in depth, because first time it's ever try to get all possible symptoms, relax the patient, and try to get all the possible important symptoms that are necessary for us. So here what I found is that, there was great sensitivity about her. As you can see the prescription over here, but I'll come to that. Basically, for selecting lachesis, there are just 2 or 3 symptoms that I look into. Now, to come to those 2 or 3 symptoms to select lachesis, it has taken me years of elimination process. So what I see in the patient here is that, this patient was very sensitive, especially around the neck, which you all know. Now, when I see that kind of a sensitivity, I always check whether the patient has emotional sensitivity. The slightest of comment, slightest of anything being told to her hurts or upsets the patient. Similarly, we also find physical sensitivity in the sense that they don't like tight clothing all over the body many times, or if it is a mother, she doesn't like being hugged too often by her children. Or another symptom that, and along with that goes loquacity. If the patient is talking continuously, need not jump from one subject to another, which is normally mentioned in Amatriotica. I'm talking about my clinical experience. So as long as the patient is talkative, if the patient is sensitive, especially around the neck, and I give them certain examples. I said, you wear a choker. In India, you have weddings. You wear a choker, which a jewelry which could be costing 5 lakhs, 10 lakhs, anything. But such a patient who's uncomfortable, the moment she enters the car, she will remove that. So we find the sensitivity strong in the patient. Next I check is the emotional sensitivity. And if that is there, my first remedy or prescription is lachesis. Here, after 2 hours of history, I decided on lachesis 30 based on just these 3 symptoms, though I had 3-4 pages of history. Lachesis 30, 1 single dose. Now, when it is a lachesis patient, dear friends, I generally give a low potency with the thought process that a lachesis is a sensitive patient. So in a sensitive patient, even a 30 potency can work like a 200 or 1M. There are times that I've given a single dose of lachesis 30 and not repeated any medicine for a year and a half, and changes have set in. So here, in short, this lady was given lachesis 30 in a week. She came. She said, I've come to India, so I will stay here for 3 weeks. I told her, I said, see, 3 weeks, so many years of suffering, 6 surgeries done. I said, before a year, I don't want you to judge. You have to give me enough time. But then she said, all right, since I've come, I'm going to stay. I'm staying with a friend. So in a week's time, she came back to me saying that I feel there is a marginal difference in my pain. But maybe it is because I'm on a holiday. So I said, do you take holidays normally in Malaysia? She said, yes, I do. So do you feel better when you take holidays? No, I don't. So, all right. So mentally, I did not jump to a conclusion, but I said, hopefully this seems to be a ray of light in darkness. After that, she went back. In the next, we treated her for a year, but in the next 7-8 months, she had only 2 episodes of pain, which used to happen a few times every month, and very marginal pain. After that, no pain. She was in touch with me for 10 years. She brought her son, her husband, all for treatment. All that was given was 1 single dose of lachesis 30, and this is without any exaggeration, dear friends. So this is the power of homeopathy. This is the miracle that homeopathy is capable of making. Next case, please. This is another similar case of the same remedy. This was a child, 11 years old, bedridden since 2 years. A child was an athlete, developed severe pain in the left and right feet and the left ankle, and the pain was unbearable. They had taken every system of medicine. The child's uncle was an allopath in the US. They had done all possible investigations, necessary, unnecessary, everything was done. They came down to India, they tried Ayurveda, that didn't work. Then they tried homeopathy with some of our leading homeopaths of those days. This again is the case of the early 90s. So then they called me up. They said, we are ready to come down to Madras or Chennai and stay for 3 months. I said, I don't want you to come now. Let me take the history. And then if required, I will tell you. So when I took the history, as you can see, there were 3 salient features. Like I said, the history, there are a lot of symptoms that you get. The question of eliminating and coming to the right symptoms, right rubric. So you can see here, there was this, how severe was the pain? The father over the phone. In those days, we had phones, there were no video calls. So over the phone, he said, I'm going to touch the leg of my child, and you please see his reaction. He must have touched the leg, and the child shrieked as if somebody has stabbed him. He said, this is the pain he's going through, and we can't bear him see that. And he stopped going to school 2 years. He's totally in bed, and we are feeling helpless. Now, after taking all the history, we found that there was aggravation by slightest touch, aggravation soon after sleep. And the child was talkative. I spoke to him, and he was going on and on in spite of all his trouble and pain. Immediately, the medicine that was selected was lachesis, though there were other rubrics. Salient rubrics also were there, but whenever I see aggravation by slightest touch or sensitivity around the neck or body, and if the patient is talkative and emotionally sensitive, first remedy is always lachesis. Lachesis, certainly one single dose sent to the US, and the rest was all placebo for a month. And I asked them to give me a feedback after a month. So after 3 weeks, I received a call from the father. So I thought that something, the child has again gone worse or whatever, why has he called me? And then I said, how is Rohan? And the father says that he's playing out. He's 45% better. One single dose of lachesis, dear friends. Only placebo. And in 3 weeks, where for 2 years the child had been suffering from unbearable pain, relief with one dose of lachesis 30. Again, lachesis 30 was repeated only after 11 months or so once. No pains after that. It took 6-7 months for the pain to completely go. But in 2 weeks, he was playing out in the ground, playing back at sports. So this is the power of homeopathy. Please trust, please believe. Next case, please. Yeah, this is another remarkable case. This was a very recent case. As you can see, 2018. This was a lady, 79 years old, mother of an eye specialist, a leading eye specialist of Chennai, who believes a lot in homeopathy. So she had this left AV valve leakage, and there were other complications also. Multiple angina. She used to be dysphoric on slightest exertion. Her life was miserable. She could not even walk around in the house. The topmost cardiac surgeon of India's number one corporate hospital here, which has a very big cardiac surgery department. He said that there is a new technique coming in within 10 to 12 months, and she will have to go through that procedure where we will, change the valve and do certain procedures. The cost will be 50 lakhs for the procedure plus whatever is the hospitalization. With that, her comparative quality of life will improve. So since he had 1 year in hand, my friend brought her to me. We went into all the details. As you can see, the basic, symptoms of loquacity, sensitiveness around the neck again. See, there are a lot of symptoms. Now, when I see these symptoms over there, I double check, triple check with the patient. Are they really loquacious? There are times, let me share one important point with you. There are times when the patient says that no, he or she is not talkative. Now, I do not accept that point of view straight away. I asked him, I said, okay, when you're out in the social gatherings, unknown people, you may not be talkative. How are you when you're with your close friends and family? And many of them suddenly come up, yes, with them I have so much to talk and share. Loquacity, that is continuous talkativeness, only with the close people. That also I take as loquacity, and it works. So loquaciousness, and there's sensitivity around the neck. Again, it was so very obvious. She said, I just can't tolerate anything. Even if she went to Europe or US, she said, I never wear turtleneck pullovers. And again, emotionally sensitive. That is the final confirmation point for me to give lachesis. 1 dose of lachesis 30. All this is without any exaggeration, dear doctors. 1 dose of lachesis 30 in a month. Next slide, please. Sorry, it's another case. So I'll just tell you, in a month's time, she was walking around in the house with hardly any angina, where she could not walk even a few steps without getting an angina. The angina had become extremely rare. In about 3 months' time, she was walking 2 kilometers morning and evening. And in about 6 months' time, she said, Doctor, I bless you. I have not worked like this even in my younger days. She would go into a garden and tend to her plants. She was working for her aged husband, helping him all the way through. She was cooking at home in spite of having a cook, she said. So this was in 2000, by 2000, mid-19, this was the situation. To this day, the lady remains absolutely normal. After 1 year, sorry for giving the name, the corporate hospital here received that machine that they were waiting for, the latest technology that was to help for such cases. The doctor in charge invited them to come over for a check. And when he checked them up, he said, you don't need this procedure. What have you done? Friends, gross pathology being corrected by one single dose of Lacus 30. And I have given you tremendous clues, just 3 symptoms. It sounds so easy. It has taken me years to conclude that these 3 symptoms alone are enough to select Lacus, and it can work a miracle. Next case. This was another challenging case in my very first year of practice. A leading jeweler from Bombay had come down to Chennai and they were referred by someone. This was a child who was 3 years old, physically and mentally challenged. He did not have any emotions. He never recognized his parents. He would keep crying and wailing, no other emotion. And he had no strength in his bones. His neck was drooling, drooping. His spine had no strength, like a slop of flesh. And he was on to a high dose of anti-epileptic drugs. He was taken right up to the US for all possible investigations and treatment. Then they also tried homeopathy in Bombay with some of our senior most homeopaths of those days. Nothing had worked. So when they came to me, I told myself, I said, God, I have got to find something which some of our senior most homeopaths have failed, some rare rubric, some rare symptom from this patient. Now, when this mother told me the complete history of this child, the child had a fall. He had fallen from the ayah's hands and hit his head. So all those aspects would have invariably been looked upon by our senior homeopaths who were treated. Now, while telling this story, complete history, the mother came back twice or thrice to the same point where she said that during the 8th month of her pregnancy, she had seen a horror movie. Now you all know that our parents, grandparents always warn the would-be mother, do not see anything bad, do not see anything that creates fear, because it has an impact on the child. We know that. And in homeopathy also we believe the effect of chronic fears. Now what this mother said, she saw this horror movie. It took her 3 long weeks to get over the fear, the scare of them. Now, looking at that point, I said, all right, this seems to be one salient feature, because thrice the mother came back, or that lady came back to the same story again and again, and it showed how much afraid she had become then. So, the remedy for chronic fear, only one, major, opium. So, in those days, with whatever little experience I had, I gave 1 dose of opium and followed it by saclab, placebo. And I said, after a month, once a month, give me a feedback. And I always give them a time frame. I said, before 1 year, I don't want you to judge. You have to give me enough time. I did not give any medicine for the physical or mental retardation, nothing, on to the probable causative factor. After 1 month, when they call her, the mother was so ecstatic over the phone. She said the child is holding the head, child is able to hold his spine better, the child is smiling at us, he recognizes us. Now, this was the effect of 1 single dose of opium, and probably on the causative factor. So, see how we can look at the same case from so many different perspectives. Each of us, our homeopaths are so successful in their own right. Each of us have our own approach towards cases. And here, friends, you can see how the probable causative, not the probable, it obviously was the causative factor, that fear that impacted the child before birth in vitro. Next case, please. Yeah, this was another challenging case. This was a case of ADHD. We all treat ADHD, very hyperactive, restless, screaming to the extent that they had put her in the LKG, but every day the mother had to be with the child, and it used to be extremely difficult to control when you would get into those bouts of shrieking, and difficult to control his anger at that time. Next slide, please. Now, you have this history, which was not significant, so I'm not going much into the past history of the child. But during pregnancy, the mother was diagnosed with gestational diabetes. And if you look at the family history, the elder brother, speech delayed hyperactivity, yes, there's an autoimmune background. And then diabetes, if you see, friends, maternal grandmother, paternal grandmother, paternal grandaunts, paternal granduncle, maternal aunts. Now, this is another major secret I'm sharing with you from my experience. When you have a strong family history of cancer or diabetes or tuberculosis, and for that you have to be doubly, triply sure. I question and cross-question my patient to make sure that that background is there. So if you have 3-4 members of the family who are diabetic or having cancer or have had tuberculosis, the first prescription always think of is carcinosin. Next page, please. Next page. Next slide, please. Yeah. Next slide after that. This is just the general history. I don't want to spend time. Now, based on the strong family history of diabetes and also that the brother also was autistic, I have treated n number of conditions. I have made a presentation only on carcinosin. Initially when we started practice, we were taught that nosodes are only intercurrent remedies. We were not taught that nosodes by themselves can be curative by themselves. But about carcinosin, I have had innumerable cases with me, and I have shared you the greatest secret. Again, that has taken me years to conclude, where just a simple history of diabetes and or cancer or tuberculosis, first prescription of carcinosin, one single dose followed by placebo, 80-90% of the cases respond irrespective of the condition they have. And this, friends, I don't hesitate to tell you, I learned from senior Dr. Shankaran, Dr. Rajan's father, Dr. S. Shankaran. Dr. Sharma would know him. Dr. S. Shankaran's booklets, they are invaluable. At the end of this presentation, I'm going to give you a tips on a few books that will be like your friends in need when you practice. So this case was given what? Single dose of carcinosin 200. Next slide, please. Now, as you can see, within a month, some positive signs were seen. Started only carcinosin. Started guided playing with his parents. Started taking new foods. After some time, you can see better focusing. Reflexes have improved. Next, you see restlessness in class. Restlessness has reduced, much lesser. And finally, if you see 2019, comprehension much better. Doing very well with the studies, writing both. Overall, remarkable improvement. The teachers, the parents were also happy. It took 2 years. But carcinosin, occasional doses, maybe once a month or so, was a remedy. One single dose. This is the power of homeopathy. These are the miracles that we talk of. Next case, please. Yeah, this was another case, where a simple case, but very surprising results. This was a child from China. They called me up. From 6 months, he was suffering from painful callosities in his foot. You can show the next slide, please. Now you can see this photograph. You can see the callosities. These callosities used to get infected heavily. They a year back they had done laser treatment and got them out. Within that year itself, again the callosities came back, and then they were getting repeatedly infected. No medicine helping. That stage they had called up. So I told the parents, I said, before 6 months, I don't want you to judge. You will have to give me time, but we'll get rid of this. Now, when we looked into the history, like you would have seen in the previous slide, the previous slide, please, one moment. Yeah. Now, please look at the history. You see diabetes, the paternal grandfather, great grandmother, and you see cancer, n number of patients with cancer. What remedy would you think of? You've already seen it. So we just sent them one dose of carcinosin. Otherwise, we are thinking of anti-crude, and then because of infection, whatever else, maybe an echinacea with it and all that stuff. But the moment we got the family history so strong, we just sent a dose of carcinosin 200 and followed by placebo. Next slide. And I told the parents, we were not expecting. I said before 6 months, anywhere from 1 to 6 months, these callosities should go, or sometimes it may take even longer to completely get rid of them. Friends, in 3 weeks' time, the callosities completely disappeared. See the last picture there after treatment. Not a scar, not a mark. In 3 weeks, the callosities had fallen off. One single dose of carcinosin 200. So do not worry about the diagnosis or prognosis of the condition. If you have these symptoms of carcinosin, family history of diabetes, cancer, or tuberculosis, in at least 2 to 4 members of the family, first prescribe carcinosin. If that does not work, then only go ahead. Most of the time, it will work a miracle for you. Here, dear doctors, I am also known for treating incurable eye conditions. We have cases who have got back vision after losing it after 5 years, 10 years, so on. Different types of conditions. I'm sharing a couple of cases with you. This was the case of a leading cardiac surgeon of the country, you can say, in this big corporate hospital here. And she had blepharospasms, painless blepharospasms, left side of the face, constant twitching of the lips, constant twitching of the eye. And she was using Botox ointment initially, then Botox injections, which would give temporary relief for a short while. She had a history of rheumatoid arthritis, a lot of other background was there, pressure urticaria. But when we got further symptoms, as you will see, all this became obscure. We did not give it importance. Next slide, please. Again, her vision was further affected. Apart from the spasm, vision became dim since 4 months. they felt there was some intraocular occlusion. She also had a history of syncope, coronary angiogram done, appendectomy, hysterectomy, all this background. Next slide, please. Now, some of these things could have been important if I did not have the family history that you can see here.
Sorry for
Diabetes.
interruption, sir. Sorry
Yes,
for
how much
interruption.
time left? Sure, please.
Sorry
Yes,
for
Dr. Sharma.
interruption. Now our special guest of today is Dr. Anil Khurana, sir,
Okay,
will
sure.
join our
Oh, it is
session.
already 2:30. Okay, I will just end up with this. So here also carcinosis was given because of the family history. And this lady does not have any more blepharospasms. The injections have stopped in about 2 years' time. Thank you so very much. We will meet sometime again. Thank you.
Thank you so very much.
Thank you.
Sir, Dr. Jayesh sir,
नहीं, not at all.
बहुत ही
It
आपका
was a
अच्छा
pleasure
रहा.
talking to you all.
Very
Thank you
nice.
so
Your
much.
presentation was
Thank
very
you
nice.
so much. And
We have
my
learned
regards
something.
to all of you and Dr. Khurana, sir.
Okay, sir. Thank you.
Thank you, sir.
Thank you, sir. Thank you, Dr. Jayesh, sir, for enlightening us with your cases. The knowledge you shared with the students is really wonderful, and this gave a lot of confidence of single dose among the students. When the students of today's time think that single dose will not be enough, and your cases especially enlightened all the students about the miracle of homeopathy, miracle of single dose. Sir. Thank you very much for sharing all these cases that encouraged us a lot and gives a lot of boost and confidence among the students for practicing homeopathy in a classical in the way as Hahnemann has advised us. Sir. Thank you, sir. Thank you so much for sharing and giving us so much confidence in so many incurable cases that are cured by you by a single dose of homeopathic medicine, sir. Well selected homeopathic medicine, single dose, and we have seen the results, the miracles of homeopathy. Thank you, sir. Now it's our time for our special guest, Dr. Anil Khurana, sir, to join. And he'll be joining us shortly as he has just conveyed us the message. Dr. Anil Khurana, sir, will be here in a very short while. We are extremely sorry, Jayesh, sir, that we wish to hear you for hours, but due to lack of time, and we have lots of students and the presenters waiting. Therefore, we have to stop this presentation here itself. But in near future, we would definitely love to call you again, and if possible, personally at Jyoti Vidyapeeth Women's University, so that our student can learn lot and lots from your experience, sir. Thank you, sir.
हाँ सर, आ जाइए सर.
लिंक भेजा है, इसमें तो ये फेसबुक या यूट्यूब में लिंक करो, दूसरे के लिए कह रहे हो.
नहीं, यूट्यूब वाला नहीं है सर, डायरेक्ट है, डायरेक्ट लिंक है ये आपके पास.
नहीं, ये तो सीधा उस पे जा रहा है, यूट्यूब या फेसबुक के थ्रू जा रहा है.
एक मिनट सर. कभी
जी सर, आपको भेज रहा हूँ. जी,
खुराना सर बोल रहे हैं कि ये तो फेसबुक का लिंक है.
सर मैं 1 मिनट करवाता हूँ सर.
हैं?
मैं एक बार आपको मैसेज कर रहा हूँ सर. आई एम जस्ट सेंडिंग यू द लिंक. जस्ट अ मोमेंट.
भेज रहा हूँ सर, 1 मिनट. यही तो है यार. Are we?
Dr. Anil Khurana sir will be joining us shortly. Sir has sent the link for joining to him, and he will be with us in a very short while. Dr. Anil Khurana sir is the chairperson of National Commission for Homeopathy, New Delhi. Dr. Anil Khurana sir is going to join shortly. Dr. Anil Khurana sir has remained the Director General of Central Council of Research in Homeopathy for a very long time, and presently he is working as a chairman in National Commission of Homeopathy. He's just going to join in a few moments with us. And then we will be having presentations of our remaining students and interns, and also some of the faculty members. So after this session, there will be some presentations also of the students. We will also be having some eminent speakers today with us, like Dr. D.K. Sonkar. He is the President, National Homeopathy Medical Council. I think Dr. Anil Khurana sir has joined. Namaste, sir.
Namaskar.
Namaste.
Sir,
Welcome,
namaste.
sir.
I welcome to you.
Thank you.
You are the special guest for the day. Today's.
Yeah. Okay, thank
So
you.
it is our. Thank you, sir. You please say a few words.
Oh, okay, thank you, Dr. Sharma. And I hope the audience is from students and faculty side mostly.
Yeah.
Yes, sir. Yes, sir.
Okay. And we are discussing more of research side and their other aspects. I have been a researcher since last 34 years and before joining commission. And as per my past experience, we need to develop a kind of a research literacy among the students. And that's why we have now, under the commission in the first degree regulation, which has come out, we have added as a separate subject of, as a part of community medicine, we have given a stress on research methodology in the UG curriculum. The reason being that you cannot understand research which is published in a journal unless you know the basics of those research. And that's why the terminologies which are used in research or the medical statistics, that has to be understood as an elementary knowledge to read the article and then understand what has been the outcome of that research, what kind of research that have been, what kind of evidence it has generated, the levels of evidence, the statistical methods used, how the ethics have been addressed on those studies. So all these aspects are highly, highly essential. And that's why the curriculum has given a weightage to that also now. Although in a PG regulation, which is going to come very soon, we have stressed more on now details of the research methodology and statistics, which will be taught as a comprehensive course as a part of PG regulation for each subject of specialty. Because we understand that you cannot take a meaningful research unless you are thorough with that. So before they start working on their dissertation, that understanding of the comprehensive knowledge about research methodology has to be taught. And in that manner, that has been now included. The curriculum is being drafted for the PG courses, which will be becoming a very comprehensive one, not simply saying that these are the three subjects which are to be taught, but now it will be a kind of a course which you have seen in first BHMS, the CBDC, the competency based dynamic curriculum. Similar kind of a course curriculum is being drafted for PG regulation also, PG subjects. So I think that will bring a sea change in the understanding of research. So research literacy, as well as taking up a proper research which is scientific, well accepted, and publishable in a peer-reviewed journal. That is what is required. Now, after this, once you have taken up a good quality research, you have conducted a good quality research, you should know how to write a scientific article so that the journal accepts your language, whatever you have manuscripted, and then they accept it for publication because you addresses each and every scientific aspect of your study which you have taken up either as a part of dissertation or as a part of any research. So a special elective will also be given for scientific writing for journals and other aspects. So that knowledge will also be imparted simultaneously with a compulsory elective during the PG course curriculum. So whatever aim is not only to come out with a good quality, meaningful dissertation, which has come out as a scientific one, as well as it should see the light of the day, means it should come out as a publication. So it has become now mandatory in a PG regulation that each student has to submit his manuscript to a peer-reviewed journal. That is a now compulsory one. Now, third aspect. This is one about the curriculum. Second aspect is to take up research on such areas on which you have a potentials. There are different kind of studies which we take up. These are exploratory, some are small pilot studies to build up an evidence, start building up those evidences, and then take up phase 2 trial, phase 3 trial, even phase 4 trials also. So whatever research we take up, whether it is of a small sample study or it is a study which is a large population based study, so those kind of researches, they require a proper understanding of the resources which will be required to take up those studies, how to build up those resources, where to tap those resources, and then how to first understand which area one should venture into. Everybody cannot take up research in each and every area. It has to be is kind of a expertise which is developed over a period of time. And before that, every researcher has to take up a detailed literature review of the area in which he wants to work upon. Unless he understands the area, what has been taken up till today, what kind of evidence has been built up on that particular aspect, and what more it can be taken up, that has to be understood thoroughly so that you do not waste in duplication of the same research which has already been done. So you have to build up on that. So your resources should not go waste while you're taking up a research. So that is one second aspect, that understanding of the research resources, how to take up that research, how resources are to be tapped, and then a great amount of literature review before initiating a study. The third aspect of whenever we take up a research in by any institution or by any individual, they should know the understanding of biomedical ethical guidelines of that. If you don't have a understanding of ethical guidelines, your study may go wrong at any place, and you may suffer some legal actions into that also. It is always good to get approval of your ethics committee approval, and for that purpose, every institution must have its own institutional ethics committee, which needs to be registered compulsorily at the Department of Health Research under Ministry of Health and Family Welfare. So there are online links available. When you visit to Department of Health Research, you can register your institutional ethics committee, and once this is constituted as per the guidelines of biomedical ethical research guidelines, and these research guidelines of ethics for clinical trials in homeopathy has also been published by Central Council for Research in Homeopathy as a booklet. Everybody can procure that booklet from CCRH, and they should thoroughly go through those ethics guidelines before you take up any clinical trial which involves human participants. For animal or laboratory-based studies, there are other guidelines like animal ethics committees constituted separately under CPC SCA guidelines. Those have to be, or you can take the help of any other institution animal ethics committee. You can submit your research proposal to those animal ethics committee and get approval from them. You need not to have that kind of a animal ethics committee, but you need to have a animal house, which is as per CPC SEA guidelines, which is the Committee for Protection of Animals and Ethical Research. So that is what is required from these kind of agencies. These are mandatory approvals which are required before initiating any study. Like there is another aspect which is called CTRI, Clinical Trial Registry of India. Now, if you want to take up a research which is a clinical trial on human participants, it is compulsorily that before enrolling a single participant in the study, that study must be registered on CTRI. If you are not registering your clinical trial on CTRI and you have started enrolling your patients or participants into the study, your study may not be allowed to continue, or all those participants who have been enrolled before the registry, they will not be considered as part of the study. So your resources will go waste, your whole energy will go waste into those things. So these are some of the things which are mandatory as on today. So every researcher must understand those basic aspects of these guidelines. They should be taught, they should be understood by the researcher, and that is what is our mandate right now, is that a PG student must have understanding of each and every aspect of such detailed guidelines and other aspects related to research. Now coming to the most of this, whenever we want to take up a research, we develop a protocol. Now this protocol is developed for a purpose that it has to be placed before the any ethics committee or approval committee. It may be a scientific advisory committee of an institution, it may be a scientific advisory board of an institution, or it may be any other committee which has been constituted who gives approval to that particular protocol. This protocol, which is a clinical trial, has to be approved by an ethics committee. Now, we should have a detailed understanding how to draw that protocol, how to write that protocol. What are those components of that research protocol, which has to be a detailed document. And once you have fixed up, drafted a protocol which has been approved by the ethics committee, after that you cannot deviate from that protocol. You have to take up research only under those protocol guidelines you have drafted yourself. But there can be some changes which can be suggested by the ethics committee or any other scientific body. They may tell you are going wrong at this part, or you have to modify that particular part of the protocol. That is a part of process of reaching to a final protocol where once it has been finalized and approved by the ethics committee, then you cannot violate uh, any part of that protocol while you are taking up research. But protocol amendment is also permissible, but that has to be again brought back to the ethics committee, that why you want to make a change into that protocol, what is the justification, that should also go to that ethics body, and that has to be got approved before making further enrollment of those participants into the study. So these are some of the regulatory aspects of undertaking research. As I told you in the beginning that I have been a researcher almost 34 years under CCRH, from research assistant to director general of that body of CCRH. Lot of research has been taken up by CCRH, which is published and is being published in various journals, peer-reviewed journals. Lot of research has been taken up during COVID time also on COVID-19 as a prophylactic studies as well as clinical trials, which have been taken up in collaboration with big tertiary care hospitals like AIMS, Jajjar, Chirayu Hospital in Bhopal, and then JJ Hospital in Mumbai. Those studies have been now except one study, all studies are mostly published, and one is just under review by a journal. And if you go through those published studies, you will find out that how the studies have been taken, what kind of outcome parameters were drawn, and what have been the conclusions of those studies. As I can simply say in a nutshell that in a prophylactic study, which was a very big study of almost 33,000 patient sample with a control population also, which was multicentric, means in 6 different states it has been carried out. And outcome of those study have been like this, that the protection rate of homeopathic medicine, which was declared as genus epidemicus as arsenic album 30, has been found to be have a protective effect of 76%. 76% of the population which has received arsenic album 30 have been found to be it has generated that kind of protective effect over a period of time of the study. However, this was taken up in the first wave. In the second wave, it was a slightly severe kind of an epidemic. It was not taken up that time, but it was in the first wave. Our clinical trials have been continued even into second phase also, second wave. And if I can briefly summarize what has been the outcome of clinical trials, where homeopathy was allowed to be given only as add-on to the standard care of treatment. And that means one group was receiving only standard care and another group was receiving standard care plus homeopathic medicines. So these were given on the individualization basis. It was a bedside kind of a treatment given to patients who were admitted in ICUs, and these both kind of patients were seen like moderate who required oxygen, but there was cases who land up into ICUs. They required high amount of oxygen simultaneously. They were a severe category. So these are the patients who were actually treated with homeopathic medicines, and the outcome was that in homeopathic group, the stay in hospital was lesser as compared to the only conventional care of treatment. So with the add-on homeopathy, the stay in hospital was reduced by more than 3 days. Even the requirement of oxygen was lesser at later time in their treatment method. They were off from the oxygen very early as compared to the only conventional medicine treatment. That is how the treatment and other parameters like laboratory parameters of IL-6 and other, say, D-dimer, or how the patients are when the patients are coming out as a COVID negative, all those parameters are also listed, and they have been also significantly, they have been reduced at early time. So all these publications have been now, some of the publications have already been taken up. One or two are still under review by a journal. So this is one part of the COVID-19, but there are many other fundamental and basic research studies which has been taken up by CCRH. Uh, Whenever I will find time and for a special lecture on fundamental basic research, which has been my domain area in last 20 years of my service from 2005 onwards. I was working in the basic aspects and fundamental research aspects, and in these studies have been taken up in collaboration with many institutes of excellence like Bose Institute of Kolkata, School of Tropical Medicine again in Kolkata, then All India Institute of Medical Science, Delhi, departments of physics and chemistry in Delhi University. Those are many other such institutes where we have taken up many collaborative studies to build up evidence of scientific evidence that homeopathy is not mere placebo. There is a lot of evidence of their biological activities. There's a lot of evidence that these are not simple water. It is has a much more than that information which it contains, and that's why they bring a significant biological activity as compared to the control. And all those studies are in detailed manner which we have taken up. Like a simple example, I gave you one of the study which has been taken up with the aims is on stem cell research, where we have used symphytum for to validate symphytum's action on bone healing, early bone union in fractures. So you know the stem cells, they when they mesenchymal stem cells, when they uh, develop as a bone cells, osteoclastic activity goes on to that. They migrate to the injury part, means at the fracture part, and they this process of migrating from converting into osteoclastic cells to reach to the bone uh, fracture areas, that requires bone morphogenetic proteins which are released in the body at that time. And when we studied this symphytum, the mother tincture has given us the most promising results, that the osteoclastic activity of from mesenchymal stem cells to the reach out to the as a osteoblast to the reach out to injury area. The amount of bone morphogenetic protein was significantly higher in a homeopathic group, means which has received by the cells which were given this symphytum mother tincture. There was 30% increased bone morphogenetic protein in homeopathic group. So that also gives us our validation that why early bone union helps when we give bone symphytum. And now that study is now has been taken up on animal model, where artificial fractures are created into animals, and now they are studying how early the bone union is coming up because of the symphytum. That study is going on in AIMS in their pharmacology department. So these kind of many other such studies have been taken up. Since there is not much time, so that I can give details through my presentation, that because that goes more than almost 1 hour with small brief parameters how these have been studied. And uh, I will just close down from my side by saying that in case of acute encephalitis study, which has been published in homeopathy journal also internationally, it has an impact factor, although it is a small impact factor, it is a good peer reviewed journal which is published from UK. Now this study which has been shown that although we already have got an evidence of uh, lesser mortality with belladonna in animal model, which was tested in School of Tropical Medicine in Kolkata. So we took up a clinical trial at BRD Medical College, Gorakhpur, and which is an endemic zone for this acute encephalitis. Every year the Japanese encephalitis and acute encephalitis cases come up at that area during rainy season. So children, there's a lot of mortality among those children, about 20 to 40%, depends upon the kind of a endemic zone which is inflicted at that area. This is mostly uh, Gorakhpur, Maharajganj, and then some other parts in the uh, northeastern areas. So we took up that study in Gorakhpur BRD Medical College, and that clinical trial has gone very well. This has been study has been published, and the outcome of that study is that just simply adding homeopathic medicine to the institutional management protocol, the mortality rate in homeopathic group was 15% less as compared to only allopathic treatment. So simply adding homeopathic medicine has saved 15 more children out of 100 as compared to which would uh, which could not survive in other group. So in that case, we can very well say that adding simply homeopathic medicine, which has a prior evidence of laboratory model study in School of Tropical Medicine on animal models also. The clinical trial has validated those kind of effects that simply adding homeopathic medicine can save so many of lives of such patients. So those kind of evidences have started being getting built up in our fundamental and basic research, and then translating those fundamental basic research into a translational research into clinical trial for the benefit of public. That is highly essential at this point of time, and that's why I request that everyone here that our institution should grow into a kind of a institution which is not only academic excellence, but it should have a kind of a mandate which is research oriented and contribute to the development of homeopathic science. So thank you for inviting me here so that I could speak I have in my mind, what we are doing through our commission, and how education and research can go together so that we can link education with research. That is what our purpose is and how we are moving into that direction. Thank you so much.
Thank you very much, sir, for your time. You spent,
We will follow
such a long time with
as
us
according to you.
after being so busy. So,
Thank you.
thank you again. Thank you very much on behalf of the management of Jayoti Vidyapeeth Women's University and on my behalf of also as president in charge of the university.
Thank you so much. Thank you.
Thank you, sir.
Thank you.
Thank you, sir. This was our guest of honor for today's program, Dr. Anil Khurana, sir.
Sonkar.
Sorry? Dr. Anil Khurana, sir. Dr. Sonkar, sir, is joining now. Dr. D.K. Sonkar, sir, join कर रहे हैं, sir?
बोल रहा हूँ.
Dr. D.K. Sonkar, sir, he is the president, National Homeopathy Medical College, Lucknow. This is a government college in Lucknow, and sir will be joining us shortly. Meanwhile, I would request Dean sir to his permission to kindly continue the presentations of the student, if sir allow. Then till the time sir joins, Dr. D.K. Sonkar, sir, I request you to kindly allow me to complete some of the presentation of the students. Sir, can I start with the presentation for some time? Dean sir, or President in charge, sir. I will wait for the reply of the Dean sir.
Sonkar is coming.
All right.
Dr. Sonkar is joining.
Then we will wait for Dr. D.K. Sonkar, sir. He is a very experienced person in the field of homeopathy, and he is the president of National Homeopathy Medical College, Lucknow. So, sir is joining shortly, and we will wait for him to join. We have few presentations left for the day, and we will be starting after this session shortly the presentations.
How many presentation will be given?
Sir, two for BHMS fourth year students, and we have few presentations of interns and also the faculty members. So we can do it after Dr. B.K. Sonkar's sir's presentation. It is not an issue. So we will wait for Dr. D.K. Sonkar sir to come. Dr. Padampriya Nair ma'am, are you listening to this event that is happening? Dr. Padampriya Nair ma'am? For the audience, I just want to inform you that research is incorporated in the curriculum of homeopathy and in each and every course in Jyoti Vidyapeeth Women's University from the first year itself.
कितने हैं अभी पेपर वाले कितने हैं?
दो तो फोर्थ ईयर के हैं सर, टू स्टूडेंट्स
और
आर फ्रॉम फोर्थ ईयर. उसके बाद कुछ इंटर्न्स हैं, कुछ फैकल्टी मेंबर्स हैं. We have few presentations.
सोनकर सर आ रहे हैं.
Okay sir.
एक का करा दो.
All right. So we will start with one presentation of BHMS fourth year student, and I request Sheikh Nargis to come and start with a presentation. Sheikh Nargis, BHMS fourth year.
Namaste, Honorable Advisor and CEO Sir, Honorable Registrar Ma'am, all the respected high dignitaries and chief guests. I, JVN Sheikh Narkis, BHMS 4th year student from the Faculty of Homeopathic Science, presenting PowerPoint presentation on role of homeopathy in PID, pelvic inflammatory disease. Pelvic inflammatory disease is the disease of the upper genital tract. It is a spectrum of infection and inflammation of the upper genital.
PPT बताओ. PPT.
Yes, sir. PPT share नहीं होती.
So is it visible?
Sir, is it visible? Sir?
बेटे PPT कहाँ है आपकी?
Just a minute, sir. There is some problem with the presentation. Just a minute.
Sir, is it visible? Namaste. Today's my topic is role of homeopathy in pelvic inflammatory diseases. Pelvic inflammatory disease is the disease of upper genital tract. It is a spectrum of infection and inflammation of the upper genital tract organ, typically involving the uterus, fallopian tube, ovary, pelvic peritoneum, and surrounding structure. It attributes to ascending spread of microorganisms from the cervicovaginal canal to the contagious pelvic structure. There are various symptoms in pelvic inflammatory diseases: pain, especially in the pelvic area, fever, fatigue, bleeding or spotting between the period, irregular menses, pain in the lower back and rectum, pain during the sexual intercourse, unusual vaginal discharge, frequent urination, and vomiting. Causes: many type of bacteria and cause PID. And but gonorrhea and chlamydia infection are the most common. It causes unprotected sex. Okay. Less commonly, PID happen when normally bacteria get into your reproductive organ. This can happen after childbirth, pelvic surgery, miscarriage, getting an intrauterine devices. The risk is highest in the few weeks after you provide insert an IUD. Homeopathic management: arsenic carbon. Burning in ovary region, leukorrhea, and burning offensive this pain. And from red hot varies aggravation least exertion causes fatigue better in warm room. Phosphorus: it is a beneficial homeopathic medicine from the treating PID case where there is a bleeding from the uterus between the period. CPR is an excellent homeopathic medicine for treating PID with marked pain in lower abdomen and pelvic area. Sabina officinalis is well indicated homeopathic medicine for pelvic inflammatory diseases with heavy periods. Investigation, pelvic examination, discharge collect from the urethra or Bartholin gland, cervical canal, blood and urine test, endometrial biopsy, and USG abdomen. Thank you. Any question?
Thank you, Nargis, for a wonderful presentation. Sir, we have one more student. Can we start with the presentation or still we have to wait? Okay, we will wait, sir.
Dr. D.K. Shonkar will join shortly. और भी है क्या प्रेजेंट पेपर
एक
पेपर
स्टूडेंट
वाले हैं
PhD fourth year one student बचा.
वन है करा लो उसका
All right. So our next participant is Pragya from BHMS fourth year. She will be presenting a paper.
Namaste, Honorable Advisor and CEO Sir, Honorable Registrar Ma'am, respected higher dignitaries and chief guests. I am JVN Pragya of BHMS 4th year from the Faculty of Homeopathic Science, presenting on the topic Role of Homeopathy in ADHD, Attention Deficit Hyperactivity Disorder. See the naughty restless child growing still more rude and wild, till his chair falls over quite. Philip screams with all his might, catches at the cloth, but then that makes matter worse again. Down upon the ground they fall, glasses break, knives, fork and all. How Mama did fret and frown when she saw them tumbling down, and Papa made such a face, Philip's is in sad disgrace. The lines are adopted from a poem belonging to the 19th century Heinrich Hoffmann, a German physician, psychiatrist, and poet, wrote about fidgety Philip, who couldn't sit still. The poem portrays the typical behavior of a child with ADHD living in those times, when children were subjected to discipline less permissive than at present. Attention deficit hyperactivity disorder is a behavioral disorder affecting most commonly children and commonly teens characterized by an ongoing pattern of inattention and hyperactivity, impulsivity that interferes with the functioning or development. Causes: no established cause of ADHD is still found, like many other illnesses. Still, a number of factors can contribute to ADHD, such as genetic pattern of the patient, cigarette smoking, alcohol use on drug or drug use during pregnancy, exposure to environmental toxin during pregnancy, low birth weight, and brain injuries. Etiology: ADHD has been conceptualized as a disorder affecting frontal circulatory due to associated deficit in executive cognitive function. Structural imaging studies have documented diffuse abnormalities in children and adults with ADHD. A large study of Castellanius and colleagues reported smaller total cerebrum, and four cerebral lobes that did not change over time. A structural magnetic resonance imaging study in adults with and without ADHD also revealed a smaller anterior cingulate cortex and dorsolateral prefrontal cortex. The DLPFC controls working memory that involves the ability to retain information while processing new information. Symptoms of ADHD are inattention, short attention span for age, difficulty listening to others, difficulty attending to details, easily distracted, forgetfulness, poor organizational skills for age, poor study skills for age, often interrupted by others, has difficulty waiting for his or her turn in school and social games, takes frequent risk and often without thinking before acting. Diagnosis: ADHD can be reliably diagnosed in children, adolescent, and adult using current guidelines. The child or adult patient must meet the criteria in the Diagnostic and Statistic Manual of Mental Disorder. It is important to note, however, that the DSM-4-TR criteria for ADHD symptom were derived from youth to age 17 years and therefore not specifically tailored to adults and hence may not always fit adults with the disorder. To meet the diagnostic criteria for the inattentive or hyperactive, impulsive, an individual must have six or more of the 9 symptoms. Prognosis: ADHD symptoms remain problematic in two-thirds of three-quarters of these children, and antisocial behavior in some cases amounting to CD are common. Many of these same difficulties persist in the latter teenage year. These relative deficits, however, do not tell the whole story of the ADHD child's adult's fate. Indeed, nearly all problems were gainfully employed. Furthermore, some had achieved a higher level education, example, completed master degrees, enrolled in medical schools and occupation. In addition, a full two-thirds of these children showed no evidence of any mental disorder in adulthood. Homeopathic management: medicines like coffea cruda, cyanatol, veratrum alum, and stramonium can be given in patients with ADHD. Miasmatic interpretation: almost all mental diseases are of soric origin. They are generally only a transient explosion of latent sora. In conclusion, the result of the study drawn that homeopathy is very effective in managing patients with ADHD. Homeopathy treats the patient as a whole and it annihilates the symptom at the earliest so that the quality of life of the individual, the family, and the society can be improved. Last but not the least is medical treatment, whose efficacy is entirely depend on a successful homeopathic prescription. Sometimes it becomes necessary to do the treatment on focusing to do the particular symptom like hyperactivity, sleeplessness, etc. But for better response, we must have to focus constitutional treatment, and for that, a complete and thorough study of anamnesis is required. Thank you. Any questions, sir?
No, thank you.
Thank you, sir.
You proceed.
Thank you, Pragya. That was a BHMS fourth year student. With this, we have completed the presentation of BHMS 4th year students. Now over to you, Dean sir.
We should wait for Dr. D.K. Shonkar. He is coming very shortly.
Shortly, sir will be joining us and he will be sharing his experiences and will be showering his blessings upon us.
I think in the meantime is any student can do the presentation till the next presenter joins us.
सर वो डॉक्टर D.K. शोनकर लखनऊ से जुड़ रहे हैं अभी मीटिंग से आए ही हैं चीफ सेक्रेटरी के साथ.
So all right, we can stop the student in between or he can join.
Presentation is over.
Because in conference we cannot sit idle like this. We're waiting for a speaker. It's a fact. You know, I'm telling you.
We have some speakers from the BHMS interns and we also have some faculty members.
Yes, so why not to call a faculty member now, because there is no faculty member.
No, many speakers, sir, many speakers have changed their schedule from tomorrow.
For tomorrow, okay.
Yeah.
But anyway, Ravi Jain sir, call one student, let her speak, and we can stop in between when
okay, sir.
the next.
Let me start with some interns first.
Yes, we cannot keep it ideal.
And let us start with the presentation of BHMS interns now.
Yes, I think that will be. I think Dr. D.K. Sonkar is with us. Okay, invite him.
Dr. D.K. Sonkar, sir.
Yes.
I welcome you in the post-lunch international virtual conference at Jyoti Vidyapeeth Women's University. You are the keynote speaker.
Okay, sir. Now I'm here. I'm listen to me. In which time our speech will be delivered?
Pardon?
In which time?
Your time.
Hello.
Your time is now starts.
And your time is now. You can start, sir. Your time is now. Yes.
Okay.
Yes, please go ahead.
Conclude 3:45.
Okay. Thank you very much. Here, Professor Dr. D.K. Sonkar speaking.
Yeah.
Ladies and gentlemen, today we are gathered to here for discuss a topic of most important and significant of the field of the healthcare. Listen to me, sir.
Yes, sir. Your voice is clear. Please continue, sir.
Okay. The advancement of homeopathy is research, especially in focusing on clinical trial, laboratory systems, and research and case studying as a they have to do subjects and embark on the journey that show light of the continuation, growing and development in the real of homeopathy in discipline that the gained prominence and recognition over the years. Homeopathy, with its holistic approach and individualized treatment method, has been a pillar of alternative medicines, providing relief and healing to millions of peoples worldwide. However, its progress and acceptance have often been questioned due to the need for robust systems evidence. Today we have the opening opportunity to explore the sites and made a homeopathic research and the invaluable contribution of clinical trial, laboratories, research, and case study. Clinical trial that the pillar of the evidence. So, basic homeopathic providing a scientific foundation for the evaluation of homeopathic treatments, rigorous trial conducted with meticulous design and methodology have yielded valuable insignificant in the efficiency of homeopathic remedies. These trials have explored a wide range of conditions, including acute and chronic ailments, mental health disorder, and even palliative care through the distance effort of research and practitioners. We have versed in the encourage the couplings and evidence that support we have homeopathic as a world therapeutics options. Laboratories, research, and other crucial fields of the homeopathic advancement has developed in the understanding mechanism and principle of homeopathic by employing scopes and technique. The technologists, scientists, and have enclave the masters behind the preparation and action of homeopathic remedy. From the education of new scale structure to the explorer of molecular interaction, laboratories research has provided valuable significance in the biological possibility of homeopathic wide range of potential as the therapeutics interventions. In parallel, case study have play a provide role of showing the real world applications and efficacy of homeopathy. The study provide details account of individual patients discomforting their symptoms, treatment plan, and outcomes. Through a comprehensive analysis of such case, we gain a deeper understanding of the interplay between the patient unique constitution and targeted homeopathic remedy. Case study several and bridge between clinical experience and scientific investigation, increasing our knowledge and expanding the evidence-based. As we refer upon the advancement of homeopathic research, it is essential to knowledge the challenges that research and practitioner face. Homeopathic, like and other field of medicines, encounters skips and the system after the rotated in lack of understanding of the presence notice. However, through regard and scientific laboratories and inquiry, collaboration with the showing demonstration, these barrier the integrated of homeopathic in mainstream healthcare require outgoing effort to foster dialects, promote education and strength and the research infrastructures. In conclusion, the advancement of homeopathic research, including clinical trial, laboratories, research and case study, stand as the treatment of the resilience and progress of the disciplines. We stand on the precious of a new area where the synergy between scientific evidence and clinical experience shapes the need of more comprehensive and integrative healthcare systems. Let us embrace the occupancy in bridge of the gap between convocation medicine and homeopathic, working hand to the provide the best possible care for the patients. Okay, thank you very much.
Thank you, sir. Thank you for your generous words.
Can I speak Hindi or
yes, sir.
Not?
You're all welcome, sir. No problem, sir.
Over. Thank you very much.
Sir, we would like to request you for some of your clinical experiences and other experiences in homeopathy so that our students and the faculty members can learn a lot from you, sir.
Because you know very well, we are belonging in the Eastern UP. Here so far, many people comes in field area. They speak everything just like it. Take up the symptoms. They speak in Hindi.
Sir, you can speak in
Sir,
Hindi.
you can speak in Hindi. No issue. You can explain.
Okay. Thank you very much. धन्यवाद. बहुत धन्यवाद. आप सभी का इस प्रोग्राम में मेरे तरफ से बहुत बहुत स्वागत है. जैसा कि हम विदित हैं, ये नेशनल होम्योपैथिक मेडिकल कॉलेज लखनऊ उत्तर प्रदेश पूर्वांचल से आता है और हमारे ओपीडी में लगभग ऑलमोस्ट हम ये कह सकते हैं कि लगभग 1000 से 1500 पेशेंट आते हैं. इसमें कुछ ऐसे केसेज हैं मतलब जो कि चैलेंजिंग इशू था. एंकिलोसिस स्पॉन्डिलोसिस का केस था जो एम्स दिल्ली में ट्रीटमेंट चल रहा था. क्योंकि हमारे यहाँ पोस्ट ग्रेजुएशन की भी पढ़ाई होती है. हमारे बहुत 23 स्टूडेंट पीजी के हैं, जिसमें आर्गेनल रिपेट्रियन मटेरिया मेडिका के स्टूडेंट हैं. और एंकिलोस्पॉन्डिलोसिस का केस था जो एम्स में ट्रीटमेंट चल रहा था. एक मेंबर ऑफ पार्लियामेंट तो उनके बेटे का, और वो काफी बहुत हद तक परेशान हो चुके थे. उनको डॉक्टर ने बताया, एम्स के डॉक्टर ने बताया कि भाई हमारे यहाँ तो ये ट्रीटमेंट प्रॉपर है नहीं, इसके लिए आपको कम से कम जो है पर मंथ 25,000 का कोई इंजेक्शन आता है, वो इंजेक्शन उनको एडवाइज किया कि आपको लगवाना पड़ेगा. फिर बच्चे का सारा केस टेकिंग पूरा ग्रुप हमने एक बनाया 4-5 लड़कों का. उसने सब अच्छे से इनका जो है केस डिस्कशन किया. केस डिस्कशन करने के बाद में उसकी अल्टीमेटली मेडिसिन जो है पल्सेटिला आई थी. संयोग से अगर वो मेरे पास सारा डिटेल्स हमारे पीजी स्कॉलर के पास है. और पल्सेटिला देने के बाद में जो है और पेशेंट विद इन 15 डेज जो उतने भी उसके कंप्लेन थे ऑलमोस्ट 90% जो है रिकवर हो गए. सेकेंड टर्म में आया, फिर हम लोगों ने देखा कि इम्प्रूविंग कंडीशन में, तो उसको प्लेसिबो प्रोवाइड किया गया। लगभग एटलीस्ट 2 महीने तक उसको प्लेसिबो पे दिया गया। फिर एक बार आया, उसने कहा कि सर इतने दिनों में एक दिन हमें फिर जो है पेन आया था, वो भी क्षणिक थोड़ी देर के लिए। फिर लास्ट में उस पल्सिटिला को 1 में कर दिया गया, और अभी हमें लगता है 6 मंथ इस बीच में हो गए, ओनली प्लेसिबो पे चला जा रहा। कंप्लीटली उसके जो जितने भी सारे कंप्लेंट्स थे वो ठीक हो गए। तो हमारे होम्योपैथी के लिए बहुत, मतलब वो एमपी थे, वो इतने प्रभावित थे कि दिल्ली में एक और बिजनौर के एमपी हैं, उनके बेटे को कन्वर्जन का कंप्लेंट था। लगभग हमें लगता है उसकी एज 3 ईयर्स थी, 3 ईयर्स के बाद उसको कन्वर्जन का कंप्लेन आना शुरू हो गया। वो भी सारे ट्रीटमेंट कराए, उनके रिफर से फिर वो आए हमारे पास, और उसकी दवाई कुप्रमेट, सिलेक्शन के बाद उसकी दवाई कुप्रमेट आई। 1 mg कुप्रमेट 3 डोज दिए गए, बैक 3 मंथ पीछे की बात मैं बता रहा हूँ आपको, और उसके बाद अभी तक उसको कोई कन्वर्जन नहीं आया। तो मेरा मन ओवरऑल हमारा ये कहना है कि अगर हम डीप स्टडी करते हैं और टोटलिटी ऑफ सिम्टम्स प्लस उसको रिपर्टराइज कर करके अब हम मेडिसिन देते हैं, तो निश्चित तौर पे हमें लगता है कि 100 में 80% तो सफलता मिलनी ही मिलनी है। तो हम सबको, हम शिक्षकों का ये मतलब दायित्व बनता है कि बच्चों को अल्टीमेटली हम ये उसको प्रेस करें कि आप थारो पहले केस स्टडी करो, फिर उसके बाद उसको रिपर्टराइज करो, तब टोटलिटी ऑफ सिम्टम्स के आधार पर अगर हम मेडिसिन देते हैं तो निश्चित तौर पे हमें सफलता मिलेगी ही मिलेगी। और चूंकि मेरे अंडर में वो जो पीजी लड़का है, सारा उसका एविडेंस उसी के पास रखा होगा। अगर किसी को जरूरत होगी तो हमारा पूरा उस पेशेंट का पूरी हिस्ट्री है, सारा मैं उसको मैं सेंड कर सकता हूँ, जो है उसको मैं दे दूंगा आवश्यकता अनुसार। जो है हमारे ओपीडी में, चूंकि आप सभी विदित हैं कि लखनऊ में पीजीआई है और केजीएमसी है, दो यहाँ सुपर स्पेशलिटी हॉस्पिटल्स है, मेडिकल कॉलेज है, राम मनोहर लोहिया है, और यहाँ पे एटलीस्ट कम से कम 1000-1500 पेशेंट आते हैं, जिसमें से 5 से 600 एलोपैथिक फील्ड से वापस ही मरी जाते हैं, और सफलता का रेशियो बहुत ही अच्छा है। तो हम तो ये आप सभी से प्रयास करें, हमारे जो शिक्षक बंधु इसमें जुड़े हुए हैं या हमारे स्टूडेंट जुड़े हुए हैं, ठीक है, आप प्रॉपर केस टेकिंग करिए, केस टेकिंग करने के बाद रिपर्टराइज करिए, टोटलिटी ऑफ सिम्टम्स के आधार पर मेडिसिन दीजिए, निश्चित सफलता मिलेगी।
थैंक यू सर। आप आज के बच्चों को क्या कहना चाहेंगे सर?
मेरा तो चूंकि मैं 35 ईयर से मैं इस प्रोफेशन से जुड़ा हूँ, स्पेशली भाई चिकित्सक तो जो है मेरा बच्चों से, खासतौर से जो फाइनल ईयर के बच्चे हों या जो पीजी के बच्चे हों, मेरा व्यक्तिगत उनको सुझाव है कि बेटा आप लोग खूब ईमानदारी से मेहनत करिए। आज होम्योपैथ बहुत काफ़ी इम्प्रूव किया हुआ है। अगर हम देखें वर्ल्ड वाइड लेवल पर आज के डेट में कम से कम 80 देशों में होम्योपैथी की पॉपुलैरिटी है, इसका ग्रोइंग रेट भी बहुत फास्ट है। तो आप लोग ईमानदारी और मेहनत के साथ पढ़ाई करिए, और निश्चित तौर पर अगर आप मेहनत से पढ़ाई करें, होम्योपैथिक साइंस और एलोपैथिक साइंस में बहुत ही डिफरेंस है, ये बहुत ही डीपर साइंस है। होम्योपैथिक साइंस इज अ वेरी डीपर साइंस। अगर हम खूब मेहनत करते हैं, मेहनत करते तो निश्चित तौर पर आप अपने जीवन में सफल होंगे और एक अच्छा प्रतिभाशाली, एक विद्वान और अच्छा चिकित्सक बन करके उभरेंगे। यही मेरा आप लोगों का जो है मेरा मतलब सुझाव है, मार्गदर्शन है। और कभी भी मेरे से व्यक्तिगत रूप से किसी को, पूरे मैं जितने लोग जुड़े हुए, मैं ईमानदारी के साथ कर रहा हूँ, कभी भी किसी को मेरे से अगर किसी भी तरह की कोई हेल्प की आवश्यकता हो तो 24 आवर में कभी आप मुझे कॉल कर सकते हो। जिस भी तरह का गाइडेंस ले रहा हूँ मैं 100% आपको जो है एबल रहूंगा।
थैंक यू सर, थैंक यू फॉर योर जनरस
थैंक यू वेरी मच सर। आपका
धन्यवाद।
हमने सुना, बहुत ही मार्वलस था और बहुत ही नॉलेजेबल आपका स्पीच रहा। और आपने जो अभी बताया केसेस के बारे में, इसको सुन के बाद में ऐसे लगा कि रियली इट वाज द मिरेकल फॉर द वर्ल्ड। होम्योपैथी इज द मिरेकल।
Absolutely right, absolutely right, sir. Homeopathic is a miracle. It is a very deeper science, sir.
मैं बता रहा हूँ आपको एक सच केस। एक लेडी, एक बच्ची थी 20 साल की, उसको डिस्मेनोरिया था, एंड शी वाज जंपिंग इन द बेड अबाउट 100 times a day. पेरेंट्स आर फेल। वो कहते हैं क्या करें, हम क्या करें। एलोपैथ में गए तो उसको लगा दिया इंजेक्शन फेनार्गन का, सुला दिया। फिर फेनार्गन दे दिया। फिर मेरे पास वापस आया कि डॉक्टर साहब क्या करें। I prescribe only Corocin 30, sir, and it was the miracle for that baby. वो उसका पूरा फैमिली हमारा फैन हो गया.
निश्चित तौर पर हमारी साइंस तो बहुत ही मतलब जो है ब्रॉड साइंस है सर.
यस सर, यस सर.
चलिए आप सभी को सर मेरे तरफ से बहुत बहुत धन्यवाद, बहुत बहुत शुभकामना. कैसे ही हम लोग होम्योपैथी को बहुत ऊंचाई पर लेकर के जाएं.
जी सर. जय हिंद, जय हनुमान.
जय होम्योपैथी, जय हनुमान सर. थैंक यू सर. थैंक यू.
Thank you so much, sir. Thank you for your kind knowledge. Ravi?
Now, sir, can we start with the presentations?
Huh?
Can we start with the presentations now?
कितने हैं? How much?
3 BHMS interns हैं और फिर faculty members भी हैं. तो आज अभी start कर दें या कल morning से करना है, जैसे आप कहें सर.
45 हो गया.
What should we do, sir? आप बताइए. जैसा आप कहें सर, कैसा.
एक का करा दो, किसी का.
एक वन you can do.
करा दो किसी का.
The internees are ready, sir. So let me call upon internee JBN Manisha to start with the presentation.
Okay.
Namaste, sir. A very good afternoon to all of you. Honorable Chairperson, sir, ma'am, advisor and CEO, administrator.
आवाज नहीं आ रही बेटी, आवाज. Say loudly.
Namaste, sir. A very warm good afternoon to all of you. Honorable Chairperson, ma'am, advisor and CEO, sir, registrar, ma'am, chief guest, dean and director, all the faculty member and respective dignitaries presenting through virtual media. I, JBN Manisha Sharma, pursuing BHMS intern 2017 batch. Today my topic on a review of Cantharis fasciculoria in case of urinary tract infection. Cantharis fasciculoria. Prover of a Cantharis fasciculoria is a Dr. Samuel Hahnemann. Cantharis is a homeopathic medicine obtained from the insect Lyta vasectoria, common name Spanish fly or a blister beetle. Cantharidin appears as a brown to black powder or a plates or a scales used as an experimental anti-tumor agent or removal of a warts. Cantharidin is a naturally occurring odorless, colorless fatty substance that is used as an oral fluid in the alimentary canal of the male blister beetle. Pharmacopoeial name of a Cantharidis is a Doryphora. Other varieties of a Cantharis is Cantharis cinera, Cantharis marginata, Cantharis arata, Cantharis metalli, and Mycobus. This beetle lives on a honeysuckle and olive trees in the Western Asia and Southern Europe. Methods of a manufacturing of a Cantharis vaxitoria. Cantharidin, the active ingredient in the crude drug Cantharidis, is obtained from the dried insect. Cantharis vaxitoria it is synthesized through a long series of a reaction starting with a butadiene and a dimethylic anhydride. Sphere of action of a Cantharis fasciculoria. Cantharis have seen special centers of action on a mucous membrane, violent and intense inflammation that develop extremely quickly. On a sexual organs, excessive sexual desire, acute inflammation, restlessness in a body and mind, irritable to the extreme, sexual appetite that seems to be insatiable. Gastrointestinal canal, violent inflammation from mouth to anus. Pain is a very violent and a mostly cutting, burning and a lacerating. Constant great thirst, intense aversion to all fluid, aggravated by coffee, irritation of a sore, frothy mucus, nausea and frequent vomiting. Serous membrane, rapidly destructive inflammation, cutting and a burning with the intolerable pain. Pain is a generally burning in any part of the body. On a skin, violent acute vesicular inflammation, burns and scars before blister form, but also when they have already formed pustular or vesicular eruption that itch terribly, or a burn on a touch. Glandular surface, salivary testicles, ovaries. Inflammation and burning an exterior duct of the seminal vesicle in the urethra during and after coitus. Drawing pain in the spermatic cord during urination. Cerebrospinal system. Spasm, inflammation, extreme restlessness when sitting on a line. She has to move constantly up and down to and fro day and night. Fever, external and internal burning, chill at night, which returns instantly when rising from a bed, even when putting a limb out from the covers. Urinary tract infection. The presence of a pathogen in the urinary tract is known as a urinary tract infection. Urinary tract infection is the third most common infection experienced by human after respiratory and a GIT infection. These are the frequent cause of a morbidity and mortality. UTI can occur in any age, but symptomatically, urinary tract infection occur most common in a woman of a childbearing age. UTI are classified as two types: upper UTI, including polypyelonephritis, lower UTI, including cystitis and urethritis. The urinary tract can become infected due to the various bacteria, but the most common is E. coli. Derived from the gastrointestinal tract, other common organisms which cause UTI are a Klebsiella species, Staphylococcus saprophyticus, Enterococcus species, and a Pseudomonas aeruginosa. Risk factors are urinary tract infection are common in a woman, and many women experience more than one infection during their lifetimes. Risk factors specific to women for a UTI include female anatomy. A woman has a shorter urethra than a man does, which shortens the distance the bacteria must travel to reach to the bladder. Sexual activity. Sexually active women tend to have a more UTI than to women who are not sexually active. Having a new sexual partner also increases risk of a UTI. Certain type of a birth control. Women who use diaphragm for a birth control may be at a higher risk, as well as a woman who use spermicidal agent. After menopause, decline, a decline in a circulating estrogen cause changes in the urinary tract that makes more vulnerable to infection. Clinical features are urinary tract infection do not also cause sign and symptoms, but when they do, they may include a strong persistent urge to urinate, a burning sensation when urinating, passing frequent small amount of a urine that appear cloudy, urine that appear red, bright pink, or a cola colored, a sign of a blood in the urine, strong smelling urine, pelvic pain in a woman, especially in the center of the pelvis and around the area of the pubic bone. Use of a Cantharis vesictoria in a urinary tract infection. It is a clinically seen that Cantharis vesictoria covers the case having acute infection and a burning sensation, internal as well as external, very well. This gives a first point to think about this medicine in the case of a UTI. Other than this medicine, it covers other symptoms of a UTI as well as a burning and pain before, during, and after micturition, oversensitiveness, offensive smell, urine, intolerable urging, and tenesmus, bloody urine by drop. Thank you, sir.
Okay.
Thank you, JV and Manisha, for a wonderful presentation about Cantharis. Now over to you, Dean, sir.
3:53 is over.
All right. So
7
please,
minutes more.
can we continue one more, sir? Or we have to stop, sir?
You can do.
Continue one more? All right, sir. So our next presentation is of another BHMS intern, JVN Karishma Anila. She will be presenting her PPT.
Namaste. I, Javian Karishmanula. Namaste to everyone. Namaste, ma'am. Namaste, sir. A very warm good evening to all of you. Honorable Chairperson, ma'am. Advisor and CEO, sir. And Administrative Team Director, Chief Guest, and all the Javian.
Sir, is it visible now, the PPT?
Yeah, audible.
Okay, now I'm going to start the homeopathic management in gastric ulcer. What is gastric ulcer? It is the break in the mucosa of the stomach lining that penetrates to the muscularis mucosa and extends more than 5 mm in diameter. It results into an erosion and then to an ulceration. When gastric ulcer is inflammation of the lining of the esophagus, stomach, and small intestine, lead to development of sore and causing the acetic acid to the lining of the digestive tract. It commonly appears in the age of 50 years. Location is on the lesser curvature. Shape is a saddle shape. Histopathology reveals the clear margin that penetrates the muscularis propria into the submucosa. The inflammatory debris on the epithelial surface. The macroscopic shows a punched out round oval orifice to the ulcer crater to overhanging margin. The size may be varies. Sometimes we may get confused with the gastric ulcer and the cancer. So we need a biopsy to rule out this. Complications are GI bleeding, perforation, penetration, and gastric outlet obstruction, and risk of cancer. Prognosis: when we take medication, then it will be good. If we stop the medication, then it worsens the diseases. The factors are smoking, HCl, ischemia, NSAID medications, hypoxia, alcohol, and the main cause is of H. pylori bacteria and NSAIDs, non-inflammatory painkillers if we take. What are the complaints we get in the gastric ulcers? Belching, heartburn, indigestion, flatulence, and vomiting with blood, bleeding stool, epigastric burning, or aching pain. Pain in the stomach worsen after meal. Vomiting is more common in gastric ulcer. In physical examination, we had an epigastric tenderness. Here, in examination, we feel a pain in the epigastric region. Investigations, we had to do the barium swallow, endoscopy, and endoscopic biopsy. In prevention, limit the use of NSAIDs. If it is necessary to take, then take it in the recommended dose. Take medication with adequate diet and avoiding alcohol during medication. Lifestyle management like removing stress, do regular exercise, breathing exercise, drinking 8 to 10 glasses of water every day. Dietary changes here, probiotics are very good for our gut. Avoid take non-citric fruits, avoid which are highly fatty foods. Take easily digestible foods, which are easy to for our digestion. And these are the homeopathic medicines like carbovage, arsenic album, nux vomica, calibicrome, lycopodium, argentum nitricum, graphitis, hydrostick canadensis. In homeopathic management, if you see arsenic album, it has a burning pain, craving for acids and coffee. Heartburn will be there. The stomach is extremely irritable. It appears raw and torn like a gastric ulcer. And argentum nitricum. This medication is useful when there is a sharp ulceration or burning pain in the stomach that spreads to the other areas of the abdomen. If it come to nux vomica, the pain in the stomach is felt from eating
even the smallest amount of food. The stomach region is also sensitive to touch in such cases. Kalibaikum. It is indicated for round ulcers with a feeling of heaviness in the stomach soon after eating. Food seems to sit in the stomach like a load. Appetite is lost. Lycopodium. The most common symptoms are burning and constrictive pain, as well as abdominal fullness or bloating. Thank you.
Thank you, Anila.
Thank you, Jivian Karishma Anila. Now I think this is time to conclude the conference. This is 4 p.m. now, and tomorrow we will be meeting with the. We will be continuing with this conference at 9:30 a.m. in the morning. So thank you all for joining this conference, and we hope we will be meeting tomorrow at 9:30 a.m. and we will be continuing this conference with more BHMS attorneys, more speakers, eminent speakers, and more of the individuals involved in this particular conference. So thank you all. Dean sir, I would like to officially request you to officially conclude this conference for today.
So today conference is very successfully. So I give that all thanks to all speakers and student presenters, interns. Thank you all. Raghav
Thank
sir,
you, sir.
please.
Thank you, sir. So we conclude this session for today. Thank you very much. We will be meeting tomorrow again at 9:30 a.m. Thank you very much. Thank you all for joining, and special thanks to our organizers for providing us with this opportunity. Tomorrow we will be meeting again with a new day of this same conference. Thank you very much. Have a good day.